for braving rather inclement weather. I know it's a little bit wet out there. I know some colleagues have some distance to travel. We had a really great day yesterday. So for those of you who were with us, welcome back. And for those who are joining for the first time today, welcome. We have something of the order of about 60 delegates registered to attend in person for each of the 2 days. And we've got something of the order of double that number registered to attend online. So whether you're in the room with us here in the Wells or whether you're online, thank you for taking the time out of your very busy schedules. We're really grateful to see you and have you supporting this event. So thanks very much for that. Just a word of introduction for me. So my name's Keith Jones. I'm the Programme Director for the Mid Wales Joint Committee. And one of the many privileges that responsibility bestows on me is to chair the Rural Health and Care Wales Stakeholder Group and, as importantly, support the annual conference. So it's really great to be here. For those who may be less familiar with its background, Rural Health and Care Wales, or RHCW as we're referred to it, was established back in 2014. It was one of the key recommendations of that arose from the Mid Wales Healthcare Study and the resultant report that was produced by Professor Marcus Longley and his team. And there was a key focus, I think, in that report to really encourage research and exploration of innovative and transformative ways in which we can sustain and strengthen care and health and well-being within rural communities, and particularly in Mid Wales. And from that, Rural Health and Care Wales was born. Now, as I said, this is the 9th annual conference that we've managed to put on. Last year, I think, was a celebration, I guess, of looking back at what has been achieved over the last 10 years and some of the foundations that have been put in place. So this year is very much about looking forward. Over the last 10 years, this conference has grown from a one-day event to a two-day event, and I think that part reflects the level of interest and support of the work of RHCW. But it also, I guess, is a testimony to the volume and the strength and the quality of the various presentations and submissions that we receive for consideration and discussion in this annual conference. And of course, that work celebrates some excellent examples of innovation and progress here in Wales, around the UK, and also overseas. And yesterday we were joined by colleagues from Canada who were sharing their work in terms of cross-sector working across a large rural area in Alberta. For this year, I think we've received something of the order of 54 submissions for consideration at this conference. Sadly, we can't accommodate them all as a presentation. Our time doesn't really allow that. But my hat goes off to the panel who've been involved in assessing those presentations and those submissions and filtering them to identify those which we'll be discussing both yesterday and today. However, you will note around the room we have quite a number of poster presentations. So those we weren't able to accommodate into the main plenary or breakout programme. Nonetheless, really keen for delegates here, certainly in South Wales, to have an opportunity to study those poster presentations and look at the rich and diverse content that's covered in the work that's being progressed. So we have a pretty packed programme and have had both yesterday and today. We have, I think, over the 2 days, we have 9 plenary sessions. We have another 3 or 4 of those today. We have had 18 breakout sessions, and as I said, we've got the poster presentations as well. So there's a broad range of issues covered. Now, yesterday, we focused very much on the challenges of delivery of care and health within a rural setting and looked at some really interesting ways in which some of those challenges can be overcome. Today, our focus is going to shift and it's going to centre much more on the role of communities, the role of unpaid carers and the critical role within a community setting, and really focusing in on some of those social determinants of health care and well-being. So really looking forward to some of the conversations that we've got lined up today. This morning, we'll be looking at community action research and its impact on sustaining well-being within a rural community. A really interesting conversation lined up later on around the importance of food and health and well-being. So looking forward to that. And then this afternoon, we'll be looking at strategies to combat loneliness in rural community. And we also have a very special treat later on this afternoon, where we'll be joined by the 10 of us choir from Llanidloes. And they'll be just reflecting the really important role and benefit that singing has in the healing process. So we'll be joined by the choir who will be performing for us, and that'll be a special treat to help us round off the day. So really looking forward to that. Interspersed with those main plenary sessions that we'll be working through today, we've got quite a number of breakout sessions, and hopefully you've had an opportunity by referring to the conference programme. And there's lots of abstract information in there around the range of breakout sessions and presentations that you have access to in the course of today. In addition to listening and learning and interacting with the various speakers and the presentations, though, I also want to encourage everyone, certainly here in the room, but also where you've got the opportunity online also, to interact with each other. Yeah, we've got our delegate list this year is drawn from a really diverse range of backgrounds and focus and interest. So one of the key bits of feedback we receive from previous conferences and the evaluations from previous years is the richness and the power of the conversations you guys can have. Yeah, so I really encourage you during the breaks, during the lunch periods, please reach out to each other, understand what work you're involved in, and really start building those connections that are so important to community sustainability. As you no doubt recognise, putting on a conference of this nature over 2 days with all the technological challenge of an online audience and an in-person audience here in Builth Wales, that's a huge undertaking. And I'm extremely grateful to the work of the Rural Health and Care Wales team for all of the planning, all of the effort, all of the organisation that goes into organising a conference such as this. So Anna, Michelle, Lottie, Mary, I'm really grateful for all of your efforts. And before we start the day, I guess I just want you to join me in showing your appreciation for the hard work of the RHCW team. Okay, before we get into the programme proper, as you'd expect, there are some logistical and housekeeping messages I need to convey. Firstly, from a safety perspective, we're not expecting any fire drills today, so if the alarm goes, then we can assume that's an inaction response that's required. In terms of fire exits, they are dotted to the perimeter of the room here in Builth Wales. So there's one on the left-hand corner and the back corner there. And of course, we've got the door where you came in. If we do have to leave the building, then I would request that everybody congregates in the car park area just outside of the international building, just across the road. Yeah. Toilets to my left of the stage, yeah, and again, we've also got facilities over in the international building when some of you attend the breakout sessions there. We are recording today, as we did yesterday, yeah, and the video recording will be posted on the RHCW YouTube channel for everyone to watch back, for colleagues who weren't able to join us, or whether you missed a particular session and you were keen to see, then you'll have the opportunity to review that. If for any reason individually you're uncomfortable with that, just please reach out to any member of the RHCW team and we can accede to those issues accordingly. Similarly, as with yesterday and today, We have been taking pictures to celebrate the event, because it's important we do celebrate the work that's going on within Mid Wales. Again, if you've got any concerns about that, please reach out to the RHCW team, and we'll recognise those accordingly. We have a mix, certainly yesterday, and I think it's the case today, we've got a mix of online and in-person presentations. So just a polite request from me. When presenters are delivering their talks, either through the main plenary sessions or through the breakout sessions, if I could ask all colleagues online to mute your microphones and put your cameras on, just helps reduce the demand on the bandwidth of the connection. And for colleagues here in the room in North Wales, you can just make sure your microphone, your mobiles are either off or muted. Yeah. We want today, as was the case yesterday, to be as interactive as possible, and we really encourage your feedback and questions as we go through the day. Just a word on how that's going to work then. We will have some roving microphones around the room when we come to the question and answer session, part of each presentation. If I can ask colleagues just to pause until they receive the microphone and introduce yourself before you pose your question. Yeah. I will, for the benefit of colleagues online, just because some of the sound challenges within this room, I will repeat your question just for the benefit of colleagues online to understand the question that's been posed. Yeah. It's probably an important message I need to convey around format and logistics for the day. So you will have noticed from the agenda, we've got a range of plenary and breakout sessions. All of the plenary sessions will be in this room, the Montgomery Pavilion. For those online, I think that's the main Teams room and link you've got access to. However, the arrangements are slightly different than for the breakout sessions. So there are some breakout sessions that are delivered in this room. And again, for colleagues online, for the advice and link that you've been provided for that. However, the other breakout sessions will be delivered from the international building that is just across the way here in North Wales. There are some of those are being delivered on the ground floor, and some of those are being delivered on the first floor of the international building. There's fairly clear advice and instruction in the conference programme as to where the individual breakout sessions are being held and located. For colleagues online, just follow the link to the international first floor or ground floor as relevant to the breakout session you wish to attend. I mentioned the poster presentations that are dotted around the room. I think we have 27 in all. We are really keen to receive your feedback and evaluation of content of those presentations. And I saw some colleagues earlier avidly reading and looking at the content. In your conference packs, there is a scoring sheet and form that we really encourage you to complete and provide us with that feedback on those presentations. We are intending to run a bit of a competition, so we are looking to rank the top 3 poster presentations, and we are intending to offer a special award once the conference is completed to the highest ranked presentation. So for colleagues in the room and those online, really keen to receive your feedback. I think for colleagues online, we'll be sharing the poster presentation content after the conference. So you've got a few days afterwards to give us your feedback in respect of those presentations. Just one word of apology and explanation. The numbering of the poster presentations as reflected in your conference programme does not accord to the numbering of the boards here in the room. So just bear that in mind when you're scoring, that you'll need to double check which particular number you're referencing. And can I just check, what are we requesting colleagues to do? Is use the number on the board, yeah? So when you wrap your presentations, reference the number on the notice board and not in the conference programme. For colleagues online, we'll clarify that when we share the poster presentation content with you, yeah? And when you're evaluating those poster presentations, really want your feedback in respect of their quality of the information provided and the research underpinning the work. Of course, their relevance to rural health and care. Keen to get your reflections on design and attractiveness of the presentation, but also with your reflections on the extent of innovation and their relevance to the future. Yeah, so those are the scope and criteria that we're asking you to consider. Yeah. Over to my right, and Sean, I think this is still the case. Yeah, so we are joined by colleagues from Welsh Ambulance Service today, as was yesterday, and Sean is available to have any conversation with yourselves around CPR. Yeah, Sean is prepared to run some demos if colleagues in the room would appreciate that during the coffee and lunch break. So if you have any questions around CPR and what to do, or need some advice or information, Charles and Amy should be really keen to support you. So please take the opportunity to avail yourselves of that. Hopefully, when you arrived in the room here in Dyfed Wells, you should have been made aware of the translation facilities that are available. Yeah. So I can see various headsets on the tables around the room. If for whatever reason you don't have a headset available, just reach out to the registration desk and the team will be able to support you in that respect. For colleagues online, and again, obviously with the Teams function, just follow the relevant bar at the top of the page around choosing your appropriate translation facility for that. So hopefully that will work. Any issues with that, either in the room or online, just please let us know and we will give the appropriate advice. Yeah. Okay, I think that covers all of the core announcements I need to share with you. So really keen to progress with the day. Yeah. Just a clarification, I guess. Unfortunately, we've had to change the running order of this morning's programme. Unfortunately, Richard Fry, who was due to deliver our first plenary discussion, is unable to be with us this morning. Yeah, so I'm really grateful to both Amy and Jessie, who've agreed to step in and deliver the first presentation for us. So Amy Nicholas is a community action, led action research facilitator for the Local Policy and Innovation Partnership, and Jessie Buchanan, who's the director for Together for Change. They kindly agreed to step in this morning and have prepared a really engaging session for us to get our teeth into around the role of co-produced community action research in sustaining the welfare of rural communities. So if you could please show your appreciation for Amy and Jessie, and as I said, we'll have roughly about a 20-minute discussion that they'll share their thoughts with us, and then we'll have around 10 minutes for a Q&A session at the end. So Amy and Jessie, please come to the stage.
Good morning, Borada, can you hear me? Perfect. Well, good morning. It's an absolute pleasure to be speaking here. This is a conference that I look forward to every year. It always stretches my thinking about how we all shape our well-being and health and the well-being of our rural communities, of which I'm very much a part. It's a conference that I always leave with a real sense of determination to share the messages from here and some practical actions. And that's what I like about it. I fill my pockets up and I'm able to take them away and work within my own community. So this practice-driven approach is something that we're going to be talking about today. I'm Jessie Buchanan. I'm the Director of Together for Change Company, and this is my colleague, Amy Nicholas. Thank you for the introductions, please. So Together for Change is a... Say a bit more. There we go, it's working. Together for Change is a social enterprise. We started life in a small charity called Solva Care, or Gofal Solvach, that some of you may know about. And that was a charity supporting old people in the rural community, coastal community of Solva to live well and to live independently. And that charity has really worked, I think, because of the strong partnerships, the strength of the community around it, and the ambition and aspirations and determination of lots of the people who live and work in that community. So in 2020, with this spirit in mind, a group, and I'm going to call this sort of campaigners, people in the community who have an interest in place, came together to try to build on this vision of community enterprise and buy this farm that you can see on the photograph here. So this is Recordiad farm. It's a county farm, it's owned by the local authority, and a group of us came together with a really strong vision for how we could use this to support community wellbeing. We set up a CBS, we raised over £500,000 to buy the farm, but due to some challenging relationships with the local authority, the public sector, we weren't able to buy the farm and we lost the farm at auction. And on the back of that, we had an event about a month later in 2020 in the Merlin Theatre in Haverfordwest. And at the end of it, the chief executive, it was called Wellbeing, People and Place, which is the theme that we'll keep coming back to. The chief executive at the end came up to me and said, "Oh, Jessie, if only we just talked more." And I thought, you know what? After all of this time, this year of working together, so relationships matter hugely, and that's why Together for Change has come into life, and that's why the work that Amy and I both do are really driven by building partnerships and relationships and strong connections with people. So we've got this programme for Communities of Place that we work with, which is about sharing a vision, working together. It's about a research and evidence base that supports that. This conference brings together some fantastic research and evidence to the fore, so we've got to use that and build on it. And then looking more at the sustainable future and how we're all supporting long-term investment. So these are our priorities that we work with, and these continue to inform the work that we do. And our approach is really based on sharing knowledge, experience and ideas. And again, today is a fantastic opportunity to be able to do that. So this collective approach, we're going to focus on an example that really sings out this message about partnership working, relationship working, working with the sectors for a community's wellbeing. And this example is the Cynhadledd Local Policy Innovation Partnership for Rural Wales that's been mentioned. And it's timely to be bringing this to the conference today. You can see from the map on the right that these are the Welsh Local Government Association Rural Forum members. So Wales is largely perceived as being a rural country, and so therefore the health and wellbeing needs of our population reflect this. So what is the LPIP? It's a 3-year programme from January 24 to December 2026. It's a partnership led by Arloesedd University, but with the universities of Bangor and Cardiff, but also other key partners like Rural Healthcare Wales, Together for Change, Antir Cymru, DEG, Representatives Rural, Skemmer, CAT, and also other strategic ambition partners who are named up there. So what does it do, the LPIP? It connects researchers, communities, policymakers. It's made up of some fantastic colleagues and people that all work together. And I think there's a real strength in working together across the sectors in that way. It works with communities across rural Wales to explore some of the innovative solutions to the challenges that we all face that are already in place. We already know that. I've had a few conversations this morning where we know what some of the solutions are and what the challenges are. So the LPIP is really trying to address that, and it's part of a UK-wide programme. It's got 4 themes, which you can see up here on the slide, and these are clearly interlinked. But there's also very specific work that's working to each of these areas. So we've got empowering communities for cultural recovery, supporting the net zero transition, building a regenerative economy and enhancing wellbeing in place. And you can see how those themes might play out in our rural communities. So we're going to talk a little bit more about those. The work that Together for Change is leading specifically, which Amy's going to talk about in detail, is the community-led research for action. And this is a piece of work that's really enabling a community to lead and design their research themselves. It's about supporting some of that capacity in place. We match up an academic mentor from one of the universities who's got some knowledge in methods or themes to support them. The data is brought in, analysed and collected, and then the community can use those results to be able to identify their own future solutions, such as supporting funding bids. So we're really trying to embed capacity at place. But why community-led? This is the big question. There's some fantastic work that's already been happening across Wales. There's a few examples here, and I'm sure there are many more. So we've got Diwrnod, gwledig, which is the Rural Futures Programme, some of you may know about, supporting individual communities to conduct work around their assets. The Community Research Network, Gwelliant, that was looking at can tourism work for that population. The gofal toolkit, which we presented on here a couple of years ago, I believe. Tircanol, Forwards project, and then the Resourceful Communities Partnership toolkit also. So I'm going to let my colleague Amy speak a little in more detail about the 5 communities in Wales that we've been working with initially, and then come on to the phase 2, which is got quite an exciting announcement. So I'll hand that to you.
Thanks, Jessie. So yes, in phase 1, these communities were allocated £10,000 with the support of an academic mentor and ourselves as a kind of broker between those relationships. And they were in areas that were to represent different aspects of what it is to be rural in Wales. So we've got Corwyn, Trasbeneth, the Dyfi Estuary, Newtown and the St David's Peninsula. So you can see quite a good spread spatially across Wales as well. So the topics that they were looking at was everything from community transport provision through to how you can do regenerative economy thinking locally. So one of the projects, we're going to basically do a bit of a spotlight on 2 of the different projects. We won't go into all of them in detail. So one of them was the Dyfi Estuary, and the idea was that they had a lead organisation, and that was Biosphere Dyfi. And they had a planning team, so they basically asked their local community projects, what would you like to do as a topic to fit under one of the themes that Jessie's already mentioned? And so we had the Labrador, the different Dyfi, and the Dyfi Biosphere Swifts projects. They were existing projects, already really passionate about water quality, or the massive decline in swifts. There's been a 76% drop in swift population in the last 30 years. And they were really concerned. They were already putting swift boxes up. But they were thinking about bringing these 2 projects together. How could they do that? How could they maximise this opportunity for capacity building in the Dyfi Biosphere area, which is an UNESCO biosphere site? They decided that the connecting aspect was water quality, where invertebrates live, and then they rise up into the air as insects, and that's what the swifts feed on. And so these 2 projects came together. They used some of the funding to recruit a part-time coordinator who was fantastic, called Bryn, and he made sure that all the volunteers, of which there were 45 eventually, were really involved and really kept up to date with everything. They worked in combination with the Centre for Alternative Technology to train 25 of their community members in water quality surveying and swift surveying. They then recruited additional members of the community to take part by going to community spaces such as pubs and talking a bit about some of these topics. And so they managed to get 45 volunteers in the end. And they were using some of the funding to buy water quality testing kits. So they were looking at phosphates, nitrates, temperature, pH, that kind of thing. And they were also looking at swift populations where they're nesting. Are they nesting in natural sites, in the swift boxes that have been put up? And they were also trying to look at macroinvertebrates in the water to see what then might emerge as insects for the feeding. So the team were given autonomy over the budget. They decided how to spend it. They decided that some of it was going to be on these events to recruit people, events to celebrate the volunteers' time. And it's so important to close the loop so they find out what they've been using that data collection for. And it was a really citizen science approach, and they worked with Rob Evans and Mike Woods, academics from Cardiff and Aberystwyth University, to support them. So this is a shot of the beautiful UNESCO biosphere site. And this is Bryn giving the feedback at the end. So he's done a fantastic, very comprehensive scientific report, which you can get from the Biosphere W website, and will soon be on the TFC one as well. And we had this lovely event where they all got together, and it just shows some of the key partnerships. So they also worked in combination with the local fisheries association, with landowners and community councils, that they hadn't really had those strong partnerships before. So it was really good to build those relationships and the well-being that came from that. And the volunteers told us that they really got benefit from meeting new people, learning new skills, really getting out and about in their community and feeling like they were custodians of the area. So the idea is that this is now going to be a baseline study so that they can continue to look at the figures into the future, so they can tell when something's gone wrong or not. So that was one of the projects. The second spotlight is on Newtown, a very different project. Together, for this case, Together for Change held the budgets. So we worked then with 7 volunteers who came and went really from a planning team. And they were individuals, but they were representing people who had experience from the town council, county council, and third sector organisations and grassroots organisations locally. They also had their budget of £10,000. They also decided to spend it on a coordinator who held the team together, who planned the meetings. And what they wanted to focus on, they had some reflection that actually Newtown already had lots of consultation there, had lots of surveys there, but they felt like they were always getting the same voices. There was these unheard voices, and how could they reach out to them to give them more agency in the decision making in their community. So we went about bringing in 7 academics from Aberystwyth University to give them training on creative methods. So they focused on how those creative methods could help them work more collaboratively across Newtown in the future, so that they could help them to do more funding bids. Loads more funders want people to have evidence and partnership working, and so this would really help them. So here's a few shots. They told us that they wanted a training event to be dynamic, active, lots of different activities going on. So that's what we provided for them. And you can see there, they're looking at different techniques. The one with the face drawn on there is the thinking about who's not in the room, who might be anxious to be involved in community discussions, and thinking about what their needs are so that they can design things in the future to engage with them in ways that work for their needs. The postcard you can see at the bottom there was because they told us when you go to these training things, you go back to the office, you completely forget what you did. And so this was posted to them, and it arrived a few days later to remind them what they pledged to do. So there's all these little techniques that they themselves engage with on the day and they could remember and take away. And all of the training they had resources which meant that they could deliver it on their own and capacity build and share within their own community organisations. So the techniques they learned was community mapping, Lego, serious play, photo voice, collage. And the important thing was we had Jess Healy, who was their primary academic mentor, who kind of spelled out the benefits of doing creative methodology versus interviews and traditional surveys, and some of the challenges of that as well. And then also how to analyse that data once you've got it in. We had a really nice gallery at the end, so you can see everyone's different approaches that they've taken, and they actually got a choice of 2 things that they could learn. So the idea is now they've got a cohort across Newtown who are exploring these new ideas and could support each other. What was really exciting is that they told us that they were kind of from organisations that were, busy. they were finding really struggle to find new ways to engage, and they left inspired. They were really excited about the fact that they now had a way forward, a technique to work with communities to get those unheard voices and to give those people more agency. So it really helped their well-being just participating, and it was a different way of working. It was really engaging. So that was the kind of well-being aspect for them, from them as participants, but also how they can help the wider community through using those methods. So that was phase 1. Phase 2, we wanted to make sure that those people who applied for phase 2 for £20,000 this time could really hear about this opportunity. So we went to quite a lot of lengths to make sure that it was accessible, it was online, it was recorded, it was completely bilingual. So I did the webinar in English, but we had it in Welsh simultaneous translation, and people could ask questions in whatever language they prefer to working. And we did the call out was sent through all the county voluntary councils and all the partners within the outfit, which turned out to be quite a lot of people. We envisioned what the frequently asked questions might be from the get-go and put those up. And we made sure that the bilingual application process was really simple. I think we had, apart from all the normal data collection, what's your name, we had about 3 questions to make it really, really simple, because we realised that a lot of the burden on organisations is the constant application processes. So we wanted to really make sure that was as simple as possible, but met our needs in terms of judging one against the other. And then they could ask us any inquiries. And it worked. We got 47 applications, and we invited 12 to interview, and 6 have been announced. And you are one of the first groups of people to hear this. We're very excited to let you know who we're going to be working with. We've had meetings with a few of them already in the last few days, had a little bit of a road trip around North Wales. And so one of them is a company of Wen in Bangor, which is a carrot project responding to the silent crisis facing the young agricultural sector, economic stress, demographic changes, work pressure, and the isolation associated with agricultural life through the medium of theatre. There is shop breakfast, Arloesedd in Diwrnod. How can local vegetable and fruit producers provide their produce to residents affordably and in a sustainable manner to local retailers? We've got the Pembrokeshire Education and Community Empowerment PCIC in Haverfordwest, looking at climate and community, empowering migrant and local majority communities in Pembrokeshire for a sustainable future. As you can tell, they're very different. It's going to be very interesting. And then we've got Maybe We Will in Llanberis, which is kind of building on their previous projects, Loving Our Lake. And that is a collaborative catchment-based approach to managing the Llanberis, one of the largest natural lakes in Wales. And then we have the Cynhadledd of Font Torelli and Vine in Cynhadledd, Recordiad, which is reimagining Cynhadledd as a connected, vibrant small town, linking culture, economy, and well-being for future generations. These are in no particular order, but last but not least is Gynhadledd IGGC and Gwelliant in Gynhadledd, working with the community to find holistic solutions to the housing, language, and climate crisis in different Paris areas. So they all were strong candidates because they had this perspective of collaboration and partnership working. And yeah, we're really, really excited to be working with them. I'm going to hand back now to Jessie to think a little bit about how we work.
Thank you. A couple of final reflections really to tie this work together. We have found time and again that co-produced approaches like this can really support and strengthen the broader well-being of rural places, because through the very practice of doing it, it supports connection, helps build trust and purpose. When people explore issues that matter to them and they feel like insights are being valued, I know this myself, that it creates a sense of confidence and a capacity to do more. So this process, I think, can really help places, people, communities recognise more about the assets and skills that are there, and how to, that when acting collectively, and we see this time and time again, it can really foster a sense of kind of belonging, agency, more voice, more agency, more confidence to do things in place. And finally, what does it take to work this way? I'd welcome some more conversations about this in the future, because I think this is where we have to work really hard. It takes a lot of time, it takes a lot of patience and a lot of flexibility. Places are very different, as we know. Llanberis is very different to Llanberis. And very often the relationships and clarity about those roles are more important than rigid plans, because plans change. So work at the relationships. If I give you one message today, work at the relationships and partnerships, it matters. And also if the investment is correct, this can be a real call for change and for building and supporting capacity, well-being in place. So I would absolutely give you that message. And I think we've got a couple of slides which are about a seminar series. So hopefully these will be shared. I really invite you to sign up. They're free, available to all. They're all about practical skills training. So surveys, report writing, contact talk to us at the end also. I'll leave that one there. And it's a final slide, so deal. So now, yeah, I'll move you back to that one because that's the sign up. That's exciting. Thank you very much for your time.
Thank you for a really interesting discussion there. Some really good advice in terms of how communities can engage in that. Can I check within the audience or colleagues online whether there are any particular questions you want to pose to Amy or Josie? Oh, Simon?
Yeah,
Wait for the mic.
just say a little bit more.
Sorry, Simon, just because I'm speaking to the mic.
Yeah, I find the whole approach really inspiring, really getting to the reason what we need to do in order to make real change to the on the ground. You said quite a lot about relationships. I'm not expecting you to detail a list of people you find it hard to get on with, but it would be good to know a little bit more about some of the challenges in engaging with the public sector and the challenges they have engaging with.
Okay, so just for the benefit of colleagues online, there's a question there around the challenges that team may experience in engaging with various elements of the public sector.
Thank you for your question, Simon. Much of our work relies upon relationships with the community sector and the public sector. And something that we found very often are the challenges of time. There are some very strict metrics that both sides of the coin need to follow. So whether that be around a particular funding mechanism, whether that be around a particular element of bureaucracy, some of the structures are very well established within the public sector, certainly local authorities, and the connections between working departments, be that transport or be that procurement, often don't correlate. So I feel like as an organisation, that's our job to do that. So we're trying to corral that support between them. Something we found very clearly through the work with the communities through this LCAP action research is that whilst they're born in community with community organisation leading, through time, the interests are certainly from local authorities. People start to creep into the meeting slowly. They start coming in their personal capacity and then start coming in their official capacity. And that's where the links are made through. So, for example, the public services boards, which you might be familiar with, the PSBs, are a very clear example. So somebody might attend a community research meeting about local transport or the village hall, and they'll see that this piece of work is maybe got some legs, and they'll say, oh, and in my day job, I'm working with a local authority and I'll talk to the PSB. So some of it is by stealth in relation to shipbuilding, and some of it is much more active. I can talk more about challenges, but I've given you some solutions.
Thank you, guys. Just one further question before you leave us. This question from colleagues online. Just wondering what happens after December 26th?
What a good question. As we all know, we're always in different funding cycles, and we're very aware of that. So whilst the LPIP funding cycle will come to an end, I think for ourselves, we always come back to the core principles of why we're doing this in the first place. And if those principles are around some of that capacity building in place, then the hope is that the legacy of the LPIP is born out of further work and further action, further funding. In terms of the LPIP more broadly as a partnership, I'm not sure my understanding of how that entity will continue in the future, but the partnerships are there now and the partnerships are strong. And if we can work hard to support the capacity in place, then that's the legacy from it.
If I can ask everyone to once again show their appreciation to just. Okay, one apology from me. One thing I forgot to mention in my preamble is that we really wish to receive your feedback are on the programme for today. So in your conference packs, you should have some QR codes on your tables, and for colleagues online, I think they have access to them, or not, we can read for them to you. Please, with the course of today, please find some time either for the breaks or the lunch period just to complete those. We really value your feedback. It really helps shape how we plan these conferences in future years. So please take the time to do that and share your feedback with us. Okay, on to our second speaker. I'm really pleased to welcome Simon Wright. He's a restaurant consultant, he's a food writer, he's a broadcaster. Simon is passionate around the sustainability of food chains, farming and local supplies, etc. And he actively promotes food literacy through his charity, Gynhadledd. So I'm really pleased to welcome to the stage Simon Wright.
Thanks very much, Richard. Thank you for inviting me here. It's a real pleasure and privilege to be here. I think, you know, as a kind of outsider, it's appropriate for me to thank you for the work that you do, because, look, you know, pressure's always on, never more than it is at the moment in the NHS and its functions. So I just want to thank you for everything that you do. And anyway, it's a good way. That's always a good way to start presentations, if you want to stay popular. Yeah, my name's Simon Wright. I'm co-founder of a charity called Cynhadledd People's Kitchen. We've been going for about 2.5 years now, and as Richard said, our real ambition is one of trying to transform Wales's relationship with food, and we try and do that through the medium of cooking. So Cynhadledd really came about, the idea for it came about during COVID, when we had lots of independent hospitality cooks and chefs doing not very much. And then a prospect of, well, what happened afterwards, which you'll have seen, lots of them closing down and then only opening for half a week, etc. So a sort of workforce that was out there with immense talent. And we did some thinking about, well, how could we redeploy some of that? And it occurred to me that these were probably some of the best people we could have to be teaching cooking and food literacy in the community. So that's how Cynhadledd emerged. A little bit more about me so you know who's talking to you. I've run restaurants in Carmarthenshire for 35 years. That's Wright's Food Emporium, which we run now. I used to work as a food critic, so I edited one of the UK National Restaurant Guides for 5 years. That's Anton Ego, not me, obviously, but a famous food critic. I worked on Ramsay's Kitchen Nightmares for 10 years as the restaurant consultant. I always have to make clear at this point that it was only the UK and European episodes, not the even more hysterical US episodes that they keep repeating at the moment. I do a bit of writing and broadcasting myself. My last radio series was called We Can't Go On Eating Like This. Still available on BBC Sounds online. 4 episodes set in Wales about how our food system is broken, the ways in which it's broken, and the ways in which people are trying to and starting to rebuild it. And that final picture there, a picture of the Cynhadledd, really just represents the fact that throughout all of this time, it's been a passion of mine with others to try and move the dial on food policy in Wales. I've always wanted Wales to be an example of how things should be done, because we are only 3 million people. The Senate should be, and the Senate and its policy should represent those of a speedboat, not an oil tanker. We should be nimble, we should be setting the pace, and we have control over most of the levers, or some at least, that we need in order to make that change. So I've spent a long time in that building and in other buildings like it, talking to politicians about what we do. I think it's fair to say that Cynhadledd in a sense came out of a sense of frustration about that.
that we weren't moving fast enough, that a lot of effort had gone into policy documents and lobbying, but we'd only shifted the dial on food a tiny amount. And Keg and a Bobble really was about trying to do something on the ground that would demonstrate that we actually can make a difference, and we can change the course of our food destiny. Here we are. Where are we with food? Well, look, you've only got to open a newspaper to see an issue about food almost on a daily basis. So it's not just health, though clearly health is one of the key drivers. It's environment, it's local economy, and it's food security, a wealth of issues. One of the big experts on food security in the UK wrote a book called Feeding Britain about 6 years ago, just did the government report to the National Contingencies Emergency, whatever it's called, committee about food security in the UK, quite a frightening report. And Professor Tim Lang is a patron of Keg and Bobble, and this is a statement he made to me on the radio programme, which is, we've turned food from being a source of health into a source of ill health. We've turned food from something that comes from the environment to something that damages the environment. And we've turned farming into an almost feudal state of economics. And I think that's as accurate in just a few words, a picture as you're going to get of where we are right now. And as I've said, the crises are multiple and they're interconnected. And the good news is that the solutions are the same way. They're multi-solving too. But we know the crisis in health, we'll talk a little bit more about that. Food is the biggest destroyer of nature globally. Always important to point out here, especially as we're on the Royal Welsh Showground, when we say things like that, that's not, in Wales, that's not about necessarily about what we produce. That has its own footprint, but it's about what we consume. Mostly in Wales, we don't consume what we produce. So they're two different things. And our footprint from what we consume is far, far more worrying than the one of what we produce. Biggest destroyer of nature, as I say, and by 2030 will be the biggest cause of climate emissions beyond anything else. Rural economy, what we've seen is, and again, many farmers will tell you this, but also our rural communities, we've seen the value go out of what we produce. We don't process it anymore, we often don't wholesale it, and we often don't retail it. So the money goes elsewhere. And then food security, well, you know, in many ways, this may be the biggest driver of change over time in terms of government policy, because as some of you will know, the UK produces about 60% of the calories it needs to feed the nation. That doesn't really allow for proper diversity of diet either. So we're in one of the weakest positions, if not the weakest position in Europe as far as the security of our food system is concerned, in a world where global food supply is becoming increasingly fragile. This is something else to worry. I'm full of joy here. I'll come to the joy in a minute. Okay. Okay, yeah, I'm going to make it even worse now. We mentioned the health issues. Or I mentioned the health issues. So there's just a few headlines. Primary child constipation rates up 60% in England, a 60% increase in hospital referrals in 10 years. We do meet teachers who are taking laxatives to schools primary school teachers, because they have pupils actually in pain with this. I mean, again, it'll be something you know more about than I do. Bowel cancer rates rising amongst younger people. That's been in the news recently. Stroke and dementia risk limited to artificial sweeteners. Food's doing a great job of destroying our health at the moment. I was going to have a quiz at this point, but we haven't got time. But basically, there's some figures there, and I was going to get you to match one against the other. But let me just quickly do them if I can. Total spend on school meals in Wales is the £90 million a year figure. McDonald's UK, actually it might be 76. McDonald's UK marketing, that's £89 million a year, so it's probably the 90 million figure. Total spend treating type 2 diabetes in Wales, 500 million, it depends how you measure it. Cost to the NHS of diet-related disease. I know I know the figure here for the total cost of UPF to the UK, the report that came out 4 or 5 months ago said that was 268 billion pounds a year, which is, I think, roughly what the UK spends on the NHS. So these are big, big figures, and they're not particularly well balanced when you think about the 90 million pounds investment in school food every year, but then the 500 million that's spent treating type 2 diabetes, and that's just treating. What is ultra processed food? I'm not going to go through this because you've heard a lot about ultra processed food. I'm happy to talk to anybody about it. I think it's worth pointing up because it is going to become the driver of change, in my view. It already is in various parts of the world, but it's going to become very, very difficult to see a situation in which we can reduce health inequality, which is so closely related to diet inequality, without dealing with the issue of ultra processed food on the plate. Brits are great at eating ultra processed food, as you can see. The USA's there at the top, but only marginally. The UK second, and our rates compared to, in the middle there, you've got France. Germany's probably about 2/3 of the level of consumption. And then as you go down, it's actually, some of it's related to wealth of the country as well, and GDP, because in those countries there's a less corporatized food system. This is the problem that I have sometimes, is that we tie ourselves in knots around nutrition. It's a very disputed space at the moment. The public get all these sources, from influencers through to regular reports in the newspapers. What's the latest view on bacon or coffee or whatever it might be? It's very, very confusing for the public. I think also that one of the reasons that we started doing the work that we were doing was that we feel it's a cultural matter, the relationship with food, not a medicinal matter. And there is a limit, and it's a very low limit in my view, to what you can do just by trying to educate the public through messaging. Yeah. I think we can see that really from the efficacy of the money that we have invested against the figures that we're seeing, and a steeply rising curve for diet-related disease. It hasn't worked just to try and tell people how to eat. There's a lot else going on in their lives. And I think also the complication of the message is unhelpful. Sometimes I go back to this. Some of you may know the writer Michael Pollan. Wrote some amazing books, called one of which is In Defense of Food. Going back about 20 years, he wrote a best-selling book called The Food Rules. And that was basically 75 short rules, quite funny ones, about how you should eat if you wanted to be relatively healthy, but more importantly, to have an enjoyable and creative and nourishing relationship with food. And he basically boiled it down to this: eat food, mostly plants, not too much. So 7 words of dietary advice. There is a caveat to that, though. He says when he uses the word food, he means food that is produced in the primary form, not food that's been processed. So we're talking here about a lot of fresh vegetables, etc., but same with meat and dairy, etc. It's not a prescription for everybody, in terms of some people need individual diet requirements. We're all different in terms of the diet that we need, and our bodies are all different. But broadly speaking, can you imagine if the whole of the UK did that, and what impact that would have on their health and then on health spending in the future? It would be enormous. Right, it might appear that there's a film here. Is this right? And how do I?
I'll do it from
Can you do it? I'll explain this after.
Children have thoroughly enjoyed the programme with Cook 24. The staff and chefs of Cook 24 have been, they're experts in the field. The kids have...
Sorry.
Stopped.
It's stopped. Okay, no worries. That was basically just going to be a short film about the kind of work that we
Gone along
do
on a journey,
in
but also
Keg and a Bobble. We used to be called Cook 24, so
Children have thoroughly enjoyed the programme with Cook 24.
But it,
play, Simon.
huh?
I think it's the internet.
I'll just move on to the next slide if I can. Yeah, there we go. So what we try and do is take a whole school approach, because what we wanted to do with the Keg and a Bobble project really was not just to make a difference to children's lives and, you know, the lives of people in the community, or those individuals that we're actually working with. What we're trying to do is to demonstrate what happens if you take a whole school approach to food. And what does that mean? Well, it basically means that food is treated seriously as part of a day throughout in the school. And at the moment, we're working almost exclusively in primary schools because it's a little bit simpler to address, actually quite a lot simpler to address, both from a curriculum point of view and a school day point of view. What we do is the first element is that we feel that in order to change the food culture of the school, you've got to get the kids to come with you. So we do a thing called food discovery, and we do it with every child over the age of 8 in that primary school. That's 6 half days of cooking. And they literally do start cooking from day one, within the first couple of hours. And those kids will then go on a 6-week course, which they help to develop themselves as the course goes on. They put together some of the recipes and what we're doing next week, etc., etc. And we're getting them familiar with fresh food for those kids that aren't. We're teaching them the basics of cooking. We're teaching them the creativity of it. We're teaching them the gorgeousness of fresh ingredients. And honestly, in a couple of hours, you go from a position where kids are saying, I'm not eating that, I won't eat that, I won't try it, to a position where they're quite willing to try it. One of the reasons for that is that the people who do these courses, they're coming from outside. It's a novelty for the kids, but they're also very inspirational. They're top chefs. They're really, really good cooks. And many of them have children themselves and have worked in this kind of area before. So it's a very inspiring environment. We find the kids grab it with both hands. And in fact, one of the great byproducts of this has been that the kids who seem to get most out of it are those that are least engaged at school. So we've had some great individual stories of kids' behavior improving and their contribution at school. And that's been at least partly come from the work they've done around this. The second element is, well, what happens when we go away? So you need to embed that culture in the school. So we have a thing called food leadership, where we work with the teachers to say, right, this is how you do these kind of programs. This is how you can continue doing it in the future. We get the parents involved in that, in kind of family cook clubs. And again, the results with that have been really excellent and surprising. We have lots of schools that have raised money for their own little training kitchens, found areas where they can continue to cook. Huge enthusiasm from teachers, partly because they get this buy-in from the kids, and a lot of good work with parents as well. One thing I will say about this, let me finish the other point, which is the third element is school food. You can do all this, but actually school food in Wales and the UK as a whole is generally really poor. You know, we introduced universal free school meals, and as Kevin Morgan said a few months back, well, great that we're doing that. But what we've succeeded in doing in most places is introducing universally poor free school meals. And until we overcome the issues we have with the quality on the plate, we're going to really, really struggle to make that meaningful. And we should have done that work before we brought in universally. But politicians like headline things, you know, it was argued with them at the time. Don't do this. Bring something in and bring it in 3 years' time. But no, they wanted to bring it in straight away. And the reality of school food at the moment is that not only is it very poor, the majority of it's not eaten. It has no relevance. I have to say this, we've just responded to the new nutritional standards for Wales. Those standards don't have any relevance to what appears on the plate. The idea that changing those standards is going to have an impact on children's health is utterly bizarre if you know how school meals work. Now, we're in those kitchens and we see how it works. And the reality of it is there's no point in having nutritional guidelines if kids aren't eating the food. The nutritional guidelines are set out for 5 days across a week. Lots of the kids don't eat across the 5 days. Some schools, there's no audit. If actually across Wales, there is no audit of what actually appears on the plate. So some schools leave off the bits they know the kids aren't going to eat anyway. And there is nothing in the software that governs this, because that's how it's worked. You put a recipe into some software and computer says yes or no. There's nothing in there that says delicious or even vaguely edible. So we've got to confront these realities. It's kind of why I asked the question of Jessie with the amazing work that they're doing. Is sometimes I'm in environments where people are basically just don't want to talk about the facts. And actually that isn't going to get us anywhere. The reality is that vegetables on the plate in most schools that we go into, in primary schools, are enough to put you off vegetables for life. So school lunch has to be changed. But you can't change school lunch without taking people with you. And that's the kids, the parents, and the teachers. Is this difficult? The worst thing, the most oft repeated comment I get from people is, didn't Jamie Oliver try this? And then the parents came and stuffed McDonald's. Look, I've worked on Kitchen Nightmares. I know how cynical television is. Yes, that happens with a few parents, and we've come across it. But mostly those parents are dealing with kids who otherwise won't go to school anymore. The idea that that's a major problem just isn't true. Parents are far more responsible than that. And I think one of the issues we've got is that we often generalise about communities all over Wales in different areas. And the reality is that on the ground, it's much more nuanced than that. Got to hurry up. Okay, so that's what we've been doing, and we've been delivering it in 4 schools primarily this year. It was paid through SPF, levelling up money. We are really financially precarious at the moment. We have plans for next year, but we don't know what's happening with SPF. We've got some funding. We're trying to develop revenue streams by selling our services to other people. That's working, but it takes time. And we've got a good relationship with the health board, and also with the Carmarthenshire County Council. We're trying to produce a coalition around that to work together. But that's why I asked the question, and Jessie sort of pointed out that the problem is you've got, even within the council, people that are not finding it easy to talk to each other. And different levels of management say different things and don't always communicate. The thing we did do in Carmarthenshire around school food itself was the Future Generations menu project. And that was great because we had to design 100 recipes that accorded with the Future Generations menu and then could be piloted in schools. Remember now that the chefs doing this are people like my wife, Marianne Wright, Jen Goss, Scott Davis, who in my view is one of the greatest chefs in Wales. Fantastic people working on this with the kids to come up with the menus. And yesterday I got an email from one of the schools that's involved in this in Llandilo, and they said that the first week's gone amazingly well. And there was a lovely comment there, which is like, this is like having restaurant food for free. Now, these recipes all have to meet the budget. So this isn't done with extra money. This is done with the cleverness, the intelligence of people in hospitality who know how to provide really good food at a very reasonable price. I'll be honest with you, I wouldn't want to see any more money go into school food at the moment without the system itself being reformed. Well, it's another. This is how enthusiastic kids can be about food. I don't know if this one's going to work. It'd be nice if it did because it's quite exciting. Okay, this is a song by Recordiad School Kids. cow. It's about this little cow. It's the video that we have. See it online. And, there's lots more of it. It's really good. Play it loud. It's great. I just think we did that by accident in the a couple of the kids at Gynhadledd School, which is the nearest school to where my business is, came in and told me they were doing this, and they had a band, and they thought I'd be impressed, and I was. It was amazing. So we heard their demo, and then I got some friends who were in another band. And we recorded them on a Sunday, and we made the video on a Wednesday, so it was ready for St David's Day next year, and they were on the radio and everything. It was great fun. And I think what it tells you, actually, it's not that difficult to enthuse kids about food. It tells you one other thing, which is they serve cow every week at Gynhadledd School. Now, does that sound like a good thing? Yeah. It's not allowed. Okay? So Mrs. Roberts, one of the old school dinner ladies, she's been working for the local authority for 35 years. And there are still some of these people around, and they tend to be the only people in school kitchens who can still cook, have proper cooking skills. And Mrs. Roberts basically makes cow every week. She makes it to her own recipe. It's all within budget. The kids eat it. And not only do they eat it, they come up for seconds. That's not allowed either. That would be wrong, because if you come up for seconds, you might then be eating more than is in the dietary guidelines, which actually don't make any sense and are not on the table anyway. That is the rule. Anyway, they come up, there's no waste because they have seconds. Very little goes back. It's amazing. It's mostly vegetables. It's absolutely fantastic to see. But again, it tells us that we've got very obsessed with rules and regulations that appear to show compliance, when the reality on the ground is that the outcomes are actually made impossible by the things that are supposed to make them compliant. Can I just ask you, is that familiar in any of your work generally? Are there lots of rules and regulations? Do you feel like you're doing stuff with your hands tied behind your back sometimes? You're allowed to say. I said this one not long ago in a conference with Phil Clare, just to see. And then I asked Phil, what are you going to do about this? Because everybody put their hand up. But look, I think there's so much talent. There's so much talent in this room. How can we release people to do it better and to work in partnership in the way that, Jessie was talking about? I've lost, what did I do?
You put it here, sorry, I took it on. Do you want to
yeah, is there anything else? I can't remember. Oh, there we are. We're finished anyway. Is there any time for questions? Too bad.
Very good. Let's just grab the mic.
Yes, thanks.
Thank you, Simon, for showing appreciation for there must be some questions, surely. So either online or in the room. Yeah, let's just wait for the mic to come to you.
Hi, Simon. Thank you for that. I'm like with this TV in Cynhadledd, and I see a lot of people in Cynhadledd. I'll just say my son managed to speak 6 songs as a cow. That's sorry. I just wondered what your thoughts are about secondary schools, because there's such huge difference in just that's a slight loss of control about what you need to media to just what your thoughts are.
Okay, so just for benefit for colleagues online, so the question there is around given the focus of science work in primary schools at the minute, or about secondary schools, and are they missing out?
Yeah, I mean, I think it is kind of like we took the decision to go for primary because it's a lower hanging fruit in terms of being able to influence it at the moment. Also, because we feel that you need to get, and all the evidence shows you need to get in at the earliest possible stage. But you're absolutely right. Look, it's a cultural issue around food. So you're never going to completely solve the problem of kids wanting to go out at lunchtime and go into the town and buy a pasty or whatever it might, pizza or whatever it might be. But if you change the culture around food so that kids are coming into the secondary environment with an expectation of fresh food to be served to them. Kids are coming into the secondary environment with much more knowledge about food because they're connected to it. That is the key thing, by the way. It's that I did another radio series about 15 years ago called The Kids Who Fell in Love with Food. And we basically, that point of that was because that's the only way I think that we can change our food culture is we have to change our relationship with food. And so there's great opportunity in secondary. And I think the opportunity in secondary is even greater for it to be led by the pupils as well. And this is, again, absolutely crucial. Us going in and telling kids what to eat in the way that we are, especially when it's, not pleasant to eat. I challenge anybody to say that the broccoli or quite often sweet corn that's served as vegetable in schools is palatable in any way. But how can we, what does government think it's doing, ignoring that? When broccoli comes in, for instance, goes straight into a steamer, frozen. Yeah, that's great. And then it gets taken out, served to the kids, and they can't put any seasoning on it because you're not allowed to add any salt anywhere in the cooking process. I mean, again, this is just where we get it. It sounds great, doesn't it? No salt, great. Healthy kids, fantastic. But the reality of it is they're not eating the food because it doesn't taste of anything. So you're eating more. And then the other argument I always get is we can't give them any more salt because they're eating so much salt in the processed food that they're eating. But how do you get out of that cycle? You get out of that cycle by having, I'm not saying you put tons of salt, but by reasonable amounts of salt on fresh food. It has to taste, it has to be seasoned. Kind of answers a bit of your question, sorry.
Thank you, Simon. I'm mindful we do have to run to a break. Just a question for them. You talked about those budget restraints and you talked about connection issues between various parts of the public sector. How do we scale up? So given the learning local level, how do we grow that?
So to run this across every primary school in Wales and do this complete programme, and I reckon this would be a sea change in our food culture by doing this. If you take it based on how many pupils there are in primary at the moment in Wales, it would cost us around about 70 million. It's not a great deal of money in terms of other budgets. So I think that's one of the issues. It has to be taken up by government, but government should take it up in partnership with organisations like ours and others, and the people who should be making the decisions. There was just a motion approved at Plaid Conference, for instance, that would hand back the control of school food to schools, parents, teachers, children, and community. The people that we really need to start trusting. Money-wise, it's a nightmare for us at the moment, as it is for all other organisations in the third sector. We're trying to find ways of what we want is the public sector to be more entrepreneurial. Somehow you guys can decide, right, we're going to go for this, and it isn't going to take us 4 years to do the research, the planning. We don't have that time. So we need a more entrepreneurial public sector. And Wales is well placed to do that, but they've got to take the chains off.
Simon, thank you so much.
Thank you.
Okay, it's time for a quick break. We're 5 minutes over time, so just ask colleagues to bear that in mind. We're scheduled to reconvene at 11:30, which is when the first session of the breakout presentations will commence. So I can ask everyone just to remind themselves of the talk that you're most interested in and direct yourself to the relevant location, either here in the main room or over in the international building. Same advice like the colleagues online. If I can ask colleagues when they have a stretch and grab a cuppa, if you can take that with you to the venue of your preferred talk. And then we will regather for 11:30 for the start of the breakout presentations. Just one quick announcement for colleagues here in the Montgomery Pavilion. Lunch will be back here in a minute in this room, not over in the town. Okay, thanks everyone. If you can take your seats, be very grateful. Okay, I'm really pleased to introduce Rosie Strand. Rosie is the Big Wales coordinator for Cynhadledd, Small Woods. And Rosie's going to share with us some really interesting examples of how community-led health projects can have a really positive clinical outcome for members of the community with those concerns. Rosie, welcome. I think we've got about half an hour for the session. Yeah, so if you talk to me around 20-25 minutes, we'll try to squeeze in time for questions at the end if that's possible. Yeah. Thanks, Rosie.
Hello. How's Rosie doing? Good morning, I'm Rosie. And I'm here today to talk about how community-led mental health services are changing clinical care in Wales. And I'm going to do that through talking about two green social prescribing services in Wales that started this year. So one is called Gwelliant. It's based in the Diwrnod, which we heard a bit about earlier, actually. It's in the West of Wales, based in the middle of it travels through counties and the other is nurturing health and social prescribing, which is located in the urban region in the South Wales. So these services are led by a charity called Gwelliant, who I work for, and we specialise in delivering green social prescribing across Wales, so nature on prescription, essentially. And we do this in collaboration with different communities and healthcare providers in different places. So in this presentation, we'll look at these two services that we've learned so far in the development and how they're running now. So why were they developed and how were they developed, and their ambitions collectively, including embedding green social prescribing alongside clinical care. And what these services are looking like now and how they're doing the 16 after starting in 2025. But before we start, I just want to let you know who Cynhadledd are in a bit more detail. So we're a UK-wide charity called Cynhadledd in Wales. And in Wales, we help to improve the health and well-being of people across Wales through woodland and nature-based activities. Our strapline is growing together, and with that we take a holistic approach. It's about care of people and place being interconnected. And obviously that relates to the policies of countries such as the wellbeing and future generation life. So we work in 4 key areas here in Wales. So health and wellbeing being one of the lead ones. So currently we work on 10 different outdoor health projects across Wales, 2 of which we'll talk about today. And these are running different outdoor health programs. And what that looks like on the ground is programs in women well-being, in nature crafts, in movement and walking, in all kinds of different nature connections. And we work with an average of around 3,000 participants a year. We also run training and skills. So we have actually our framework of around 120 activity leaders and professional activity leaders that run our sessions. And unaccredited and accredited courses such as the Wellbeing in Nature course that allows people to deliver these high quality sessions. We do undertake a lot of research as well. So we've got actually over a decade of research and reports documenting our work in green social prescribing, evaluating its low scales such as WebWebs and IPAC, and the 5 ways of wellbeing. And we do a lot of woodland management as well, and that looks like volunteer programs of conservation, as well as community membership to support small woodland owners to undertake social forestry. So what is outdoor health? Well, if you're a folk farmer walking in the park or taking a stroll in the woods, like these people here, it's not your imagination, it's biology. And we know the green social prescribing works, and Wales is abundant in nature. There's so much potential in this country. We know this from countless studies, such as the one highlighted today. We know that outdoors can trigger changes in the body that lower stress hormones, ease blood pressure, and can even improve gut health. So what does this look like in action? Well, let's go back and take a deep dive into these 2 outdoor health services that we're looking at today, one in the Dyfi and one in the Afan Valley, and why these services were developed in these areas. And these are 2 communities with shared challenges. So the Dyfi Valley in Mid Wales has approximately 15,000 people living in it, and has identified areas of higher deprivation in rural places. It's also got relatively poor health. So the census data recently identified that 37% of households has at least one disabled person. And a community survey identified that almost half suffered from depression or anxiety, and a third with mobility and joint pain. In the Afan region, a similar picture. It's approximately 50,000 people here. It covers a lot of different urban conurbations, from Port Talbot to Gwynedd. And again, some of the highest deprivation in Wales. 1 in 5 are permanently sick or disabled in households here, and the changes in industry are still impacting. And of course, as we know, healthcare provision is struggling in these areas and across Wales. We know in June 2025 that the time wait for treatment was around 21 weeks, which was double pre-pandemic. And that services that could reduce healthcare burdens, such as social prescribing, were in short term and lack continuity. And that, coupled with climate crisis, biodiversity loss, 20% of species since 1994, meant that these communities were really looking at how can we care better for the health of our place and our people. But there was also common opportunities as well. There's an abundance of nature sites that could be accessible or made more accessible. And there was interest from both the communities and the healthcare providers in developing some sort of longer-term green social prescribing offer that could help care for the people and place in these areas. So how were these services actually developed? Well, initially, they were pilots. They were really small, and they grew outdoor health networks. So a bunch of people got together. Everyone, different community stakeholders, the patients, to the local GPs, to the health board representatives, members of the community, from different places, and they formed outdoor health networks, and then they ran pilots in these places with different programs of outdoor health. So in the Dyfi, that looked like a 3-year pilot until 2023. They engaged around 250 people. In East Port Talbot, it was smaller. It was a few months with around 35. But what they did was they grew those networks of people who wanted to work across sector to address the challenges they were facing and the opportunities that were there. So in the Dyfi, that ended up being mainly working with the local surgeries and Street and the local hospital. And in East Port Talbot with the Afan cluster, which is a cluster of 9 GP surgeries. Both the pilots were evaluated against known scales. So people registered for activities and then they were evaluated at the end. So we have a before and after picture according to WebWebs for mental health and IPAC for physical health. And both resulted in significant improvements in participants' well-being. And active outdoor health networks looking to develop this service where they could see that it could work and they wanted it to go further. However, then at that point, the funding ran out, as we've had funding cycles are treating. Unfortunately for Newport Talbot, they had enough data and input from interviews and data to create a plan for that next phase. But for the Dovey, we managed to get shared prosperity funds for a longer consultation with the community. So one of the key things that came out of the pilot of the Dovey was developing the service of one healthcare site. So looking at an exemplar site for green social prescribing. And at that point, the local community hospital in the heart of the biosphere had been recently renovated. So it felt like a really good opportunity as it had been developed as a community hospital. Of course, a lot more services in to think that green social prescribing could sit alongside of community services. So guided by the network in that area, they undertook a 6-month study with a range of focus groups. We ran a lot of outdoor health activities, and we literally sort of made Christmas wreaths and chatted about what the service could look like. And we interviewed around 445 people, young people, older people, the staff at the hospital and surgery. And 80% of those surveys said they wanted nature and prescriptions.
People can't hear you with that.
Yeah. And around 98% felt that nature activities could improve the well-being, the challenges they were facing. Interestingly, 20% said that they like to volunteer in conservation and have been running the outdoor health. There was a real interest in really getting this going, not only to get funding in, but to put in community time and effort to make that happen. And the result for both was a plan. And that plan then enabled us to successfully apply for National Lottery Community Fund to develop these services from 2025 in both areas. So the shared ambitions in summary for both these services was to improve the physical, mental and social well-being of a diversity of people through outdoor health activities with trained professional providers. It was improving referral pathways through the health and social care third sector and self-referral. It was improving community services through conservation and well-being volunteer programs. It was improving access to nature, and in Newport Talbot, that was about selected ones that could be reached on foot and developing those. In the Derby, which was more rural, it was about finding clever community transport alliances. And it was about improving the skills by training the activity leaders to run this service as well as volunteers and organisations and delivering. So the scale of the services vary according to the resources available. So just to give you a sort of nutshell of what the services look like in each area. So in the Derby, we're looking at a budget of around 470k, which includes around 70,000 in match funding from volunteer time, really heartened by the response. And actually since then, the volunteer response has increased. So it's running over 3 years, and we're having around 1,300 participants. That's been 150 volunteers. And it's around 950 sessions over 3 years. So quite a big programme running over a long period of time with this shape of team. And in Newport Talbot, it's around 100,000 over 2 years with 300 participants and 80 sessions. Again, with a slightly smaller team. So the pilot paved the way really for greater partnership working, and I felt like this quote from Paratici Healthful, who we're working closely with in the Dundee summed it up well. It's really bringing together the strengths and expertise of people in healthcare, in the health board, from CAVA and local organisations to deliver one health service that is complementary to clinical care. But how have we actually integrated it into healthcare? And this has been an interesting journey itself, and it's definitely one that's developing over time. So key to this has been engaging partners that in both areas. So they are really the key contact, they're the linchpin on the ground. So they're out helping deliver programs, they're in the hospital and other healthcare settings, they're talking to patients, they're talking to healthcare providers. In the Derby Valley, it also looks like, which is still work in progress, there are memorandum of understanding with clinicians at the GP surgery in the hospital, as well as NHS staff briefings and wellbeing as today. So it's just started running. It's actually taking staff out into the woods in this latest service and giving them a taste of what it feels like to be a patient, but also for their own wellbeing as well. We're hoping to develop more staff wellbeing as part of this programme. We've also worked with the GPs to set targets, which we've never really done before. And they've agreed to run 80 referrals a year in the first year and seeing how that goes. And each time they make a referral, they're recording that referral on a patient record. At the same time, they're recording on the patient record and also sending an automatic text message with information about the service and the engagement officer's contact. And the team also for this service are based at the hospital half a day a week, so they're a known face in the hospital for both patients and the healthcare staff. And there's an ambition to review progress and data together as we go through the 3 years of this service. Again, similar with Port Talbot, it's a memorandum in progress again with the social prescribing team. We did 9 surgeries as part of the cluster. Again, there's briefings and meetings and an intention to review progress and data together moving forward. So one of the big questions, I think, because we're on that bumpy ride of project funding, is how can we make this sustainable long term? And it's the question we asked from the outset, really, because we have to think about where we're going and how we're going to support this. And we'd also seen the impact that the end of the pilots had had, not just on the participants and the healthcare providers, but also on the staff running them as well. So with both services, we've got a really rigorous research and evaluation process against known scales. So that includes, as I mentioned, WebWebs, the NHS 5 Ways to Wellbeing. We collect demographic data, volunteer hours. We run regular community events to get feedback to help shape the service and keep it relevant. We're also with the outdoor health networks that guide and help make these services a reality and run, looking for the potential future of a portfolio of funds. So not just relying on one lottery bid, as these are at the moment, but the different representatives around the table, the health boards, the local council, the patients board, exploring ways that they can all bring money to the table depending on what's needed. In the Derby specifically, we're looking at the introduction of social return on investment. I know many people will be familiar with that to make the economic case, and we really heard that from the healthcare providers. They were saying we know it works, but we need to know that it's saving money for the NHS as well. So we'll be looking at that more closely over the next few years. In year 2, we'll also be charging for some of the loan programmes. So having a portfolio again of both free and accessible, but also by donation or charging for those. And all the time through this service in the W, we're training volunteers to embed nature-based activity and connection in what we're doing. So 6 months in, what do these services actually look like? Well, here's a sort of photo montage summary, although there's so many joyous photos from this and stories emerging already. But essentially, it's 3 weekly professionally led outdoor activities that boost health and wellbeing for all ages and abilities. And that looks like woodland skills, nature art, animal therapy, foraging, walking and movement. And they're happening at locations from hospital gardens through to custom-made woodland wellbeing hubs. And include many sites not used before as well, and partnerships with people like RHCW and local community gardens, etc. They're being run by professional leaders who are trained to minimum standards, and for quite clear that means they have a response to DS check, and they have training in the same environment to have awareness. And they're designed these programs along with the 5 ways to wellbeing. So connect, take notice, learn, get active and give. As I mentioned before, we have different transport solutions for access in these areas. And of course, these services, as I mentioned, are guided by a local outdoor health network of community stakeholders and healthcare sector stakeholders that guide it and make sure that it stays relevant and useful. And how are they doing? well, there's a summary of stats here. I mean, I'm really active in the W Midwest. Only really started in September, but already we can see from these stats that we're heading in a positive and promising direction in terms of nature connection, physical health, social connection. And again, that is true as well for the Atlan Valley. Again, we're looking at nature connection at 100% here and a very high rating of experience, 4.96 out of 5 stars for participants who've taken part in that. And this one started in June. So how is the integration of social and green social prescribing actually going in these healthcare settings? And that is something we're constantly asking ourselves as we've lifted off in the last 6 months. As I said, work in progress. The positives, what's working is the engagement officers that are great connectors, very well involved in this service. And we're having some really great communication with the clinicians and social prescribers about what groups to work with, where to focus, and where to focus research as well, particularly on the economic cases I mentioned. In the W Valley, that whole referral pathway of recording on patients' records and automated messages to patients is working well. The challenges, though, that we're trying to resolve are really just getting the whole teams on board together. And as we know, time pressure NHS staff, there's not that much time to have deeper conversations often. And if we do, then normally often with a few select people or champions. And you need to put out, we lost our champion quite early on, and the risk of that is quite impactful. So it's slowly getting the whole groups on board, but with a little time to do that. So the number of referrals to date have been quite limited, but are growing. And I would also say that getting a formal MOU in place is ideally at the start, but for these have been work in progress. But in a way, it's not until you start doing these things and you start realising what you need, what you don't need, what will work, etc. So it is work in progress. So looking forward, I guess what we've learned is there are local and national challenges to work on beyond the ones that these services address. So, you know, the National Social Prescribing Programme for Wales is brilliant, but it's still work in development. And that joint support, we love to see more of that, which I think will help all sectors work together more effectively. And that reliable long-term funding is something that is a slow burn, and we're still trying to resolve, but we'd like to see more. But there are some successes to celebrate and build on. And these two stories really illustrate that. We can work together as outdoor health providers and communities and clinicians to identify and address shared challenges and design community-led solutions. And that if those are considered, done in a considered and measured way from grassroots through pilots and grown gradually, they make way for really positive development. And together we can try out those new referral pathways and a variety of different healthcare offers together and ground those to inform the future. Well, that's it.
Thank you, Rosie. Thank you for sharing that. We have 1 or 2 minutes available to us just before we break for lunch. Can I just check whether colleagues here in the room, in the pavilion, or those online have any questions they wish to put to Rosie? Oh, we've got one coming in. It's just, have we got the mic? I'll run.
He was bringing it. It's not your job.
Just grab this for a second. Getting his extra exercise. So. There we are.
Thank you. I'm just seeing you comment from Director. A question about the roles of coordinator, the roles of champion, and when that person then falls away. What do you do
what happens
Yeah,
next.
so just before you present, obviously just remember the comments online. So it's a question there around sustainability and the role of the coordinator and champion after the end of the project.
And that's interesting because what we're finding is obviously in Gynhadledd they've got a social prescribing team at each GP surgery, whereas in the W they don't. And the dynamic is different. So in Gynhadledd we're looking at really training the social prescriber more to fulfill that role of being that sort of glue, I guess, between communities and clinicians. And that will be one of the things we talk about in terms of sustainability in the W is there room for a social prescribing team in this cluster as well. Yeah, I mean that's sort of, I mentioned the framework for social prescribing and the development of those services and really getting the support, I guess, from Welsh Government for social prescribing services of all kinds. And we know it works across many different sectors, the arts, blue, so yeah.
Okay, thank you for that. Any further questions? Oh, just wait for the mic to arrive.
Hello, I'm Nova from the University of South Wales. My question was just about volunteers. You said you had, I think, volunteers in one project, but not in the other. So I wondered whether that meant one project was turning out to be quite different, or whether there was plans to include volunteers and then things worked out whatever it didn't happen.
Okay, so it's a question there about how the process for engaging volunteers in the respective projects.
It's mainly been about resource actually, so we've got to help have less money, it was a smaller scale. But we know that running volunteer programmes for conservation and health and wellbeing, that does create longer term sustainability. We're already seeing that actually in the one particular volunteer group at one of the Woodland Wellbeing hubs we run that is pretty much running itself now. And it's taking momentum, and there's different members who go there who are volunteers but also work in a healthcare setting, so they're holding events for their healthcare work colleagues and studying a forest from there, and it's becoming its own thing. So I guess for me, what's Talbot, they're a step behind in that, but we're going to look at that as a next step of is a huge part of sustainability and meeting connection and care of people. Thank you.
And we just have an observation, a bit of feedback, Lindsay. It's a comment from some of the colleagues on Tracy, who's online, with just measures of support really she used in the small groups project, and she finds it really beneficial as a divisional family for her clients. So some really rich feedback there for you to think about.
Oh.
Good. Oh, great. That's really positive. So, okay. That brings us to lunch, so I can just ask everybody to show their appreciation for Okay, we now have a lunch break. Got a lunch break until 1 p.m. Yeah, if I can ask colleagues to regather in this room at 1 o'clock, where we'll then move on with the plenary session 3. So please enjoy lunch, please use the opportunity to stretch your legs. If you haven't done so, please have a look at the poster presentations, think about your ranking, and also if you've got the opportunity, I would also welcome your feedback on your conference programme, the evaluation blockers. Enjoy lunch, thank you. Okay, thanks everyone. Hope you had an enjoyable lunch. If you can regather your seats. So, on with our afternoon programme, and I'm delighted to welcome Stephanie Jones to the stage. Stephanie's in the final year of her PhD study at Arloesedd University. She's undertaking some really interesting research into loneliness within isolated and diverse communities. So, if you'd like to show your appreciation for Stephanie, please.
Hello, I'm Stephanie Jones. I'm absolutely delighted to be here today. So I am belonging to Arloesedd University. I'm very, very close to having my final thesis ready for submission, which is exciting. The project itself has run over the last 4 years, so it's really been a lot of commitment, I'd say, and it's supported by Dr. Rachel Rowland and Dr. Jess Healy, who are the grant funding holders, and it's funded by Health and Care Research Wales, and Rural Health and Care Wales have been a huge support since the inception of the PhD reviews and throughout. So what I think we'll talk about first is the building.
They're talking. Stay with us, you keep talking.
Is what is loneliness? So the seminal definitions for loneliness are that it is a perceived gap between one's actual and desired social connections. So there is a real disconnection between the relationships that one has and that one would desire. However, it's much more complex than that in reality. There are social, emotional, cultural and existential dimensions of loneliness, which exist at different levels, such as the individual level, the community level and the societal level. So it really is a complex phenomenon that is unique, it's subjective, and it is experienced commonly, but also diversely. So it's really important that we acknowledge that it is a unique phenomenon for many people, and it can come across in very different ways. It's also really important that we look at the difference between alone time that is chosen and alone time that is unwanted and harmful. So solitude is what we commonly refer to as chosen alone time. This can be restorative, it can be really good for your well-being, and it can be really beneficial for many people. And we all engage in it at some point where we want that time alone. Loneliness, however, is really different. Loneliness is unwanted. It can exist in various forms, again, and for various lengths of time. And what is restorative to one person can be harmful to another. So it really is complex to study. Loneliness can also occur in the company of others, and that's really important to get that definition there, that loneliness isn't just the absence. It can also be a emotional level loneliness that can exist in a room full of people. And I'm sure many of you will have felt that as well. We then come on to rural and agricultural loneliness, which is even more complex. And this is the thing with this PhD, it's the gift that keeps on giving. Every time we've gone into different layers, it is so complex and so interesting to study. And it's so unique to the individual that it makes it quite a difficult state to really understand in its truest form, which I will come on to. But rural and agricultural communities are subject to their own unique set of factors. And that's really important to note, that rural communities face their own individual conditions and circumstances that can exacerbate loneliness and lead to loneliness for them that is unique. Agricultural communities as well, due to the nature of farming and the farming role itself, it can be really, it's busy, it's a way of life, it's more than just an occupation, and it can have detrimental impacts on people's ability to socialise. And this PhD really did pick up on some of those factors, as we will come on to. There's a lovely model by Wheeler that I would just like to mention that I've got on the slide here, and the references at the end, that really breaks those down in terms of those conditions and factors that can contribute to loneliness, particularly in farming communities. Okay, so the study. The aim of the study was to gain an understanding of the of the lived experiences amongst rural and agricultural communities. It's also wanted to understand what the factors were, what contributed to that loneliness, and then wider to that, what is the role of the community in addressing loneliness for rural and agricultural communities. The presentation today focuses on the last 2 stages of the project. So this has been a 4-phase project. I have presented here before, a couple of years ago, on the earlier stakeholder engagement, which was just integral to everything that's followed. But I am just going to focus today on studies 3 and 4. Okay. There we go. So the methods, and I just wanted to touch on this really. Due to the challenges that came with recruiting participants, and those of you in the room who work or online who work with rural and agricultural communities will know the challenges of recruiting participants for studies, particularly amongst farmers. But it is widely recognised, it's documented in the literature, and it was a challenge, it was really difficult. All of the participants, however, that participated gave such rich and in-depth interviews into their experiences that an interpretive phenomenological analysis, and I'm going to carry on by saying IPA for short, was the most appropriate study design for phase 3. Study 4, however, really speaks to the community level aspect of the project, really going out there and doing case studies, observations, more interviews with participants at livestock markets, and I spent a lot of time at livestock markets to really get this project up and running and to then gain the data throughout. So you can see study 3, we've got 8 individuals, 6 men, 2 women. All of them were aged over 40 and all of them were from rural farming backgrounds and had experiences of loneliness. The case studies looked at participants more broadly who attended livestock markets at 2 livestock markets in Wales, and the participants ranged between stakeholders and attendees. All of the ethics was also approved by Aberystwyth University, and all consent has been gained to give you a bit of a flavour of the individual stories and voices today, which I hope come through. So study 3 that explored how do individuals in rural and agricultural communities in Wales make sense of their experiences of loneliness and what the contextual factors were that accompanied that experience of loneliness. It brought out broadly 2 themes. One is making sense of loneliness in rural communities, and the other is experiences of loss. And loss was a really pertinent theme throughout this. And I'm hoping you'll be able to read the quotes of the participants. I'm not going to read them all out, but they really do give you an insight into how this loneliness was experienced for these participants. So the first sub-theme is the role of identity, and this was really integral, and it's intersecting. Each one of these sub-themes intersects with the next, and you'll see lots of overlap. But loneliness broadly was shaped by the cultural and structural context of rural and agricultural life. What does that mean? It means that farmers have a sense of duty, essentially, a sense of pride and duty in their occupation, and that farming really is a way of life that is embedded in every aspect, not only for them, but for their families, and very often that feeds into the wider community. When that's tied with intergenerational duty, so for a number of the participants, their farms were handed down to them, they were inherited, and that brought with it a sense of duty and additional pressure, I think, for many of them came through around this sense of, we've got to get this right, you know, this is our family farm. There was a real sense of pride and duty and tradition tied up within that identity for many of the participants. Through those inherited roles came an attachment to place. So for many of them, they lived on their family farms for a long, long time, and so had their parents and their parents' parents, and for some even their parents' parents' parents. You wouldn't believe how far some of these farms went back. And so there was a real sense of pride and attachment to that land. Why is that important to loneliness, though? And I think this is the interesting bit, is that it almost acted as a strength in some ways, because it provided a sense of belonging. However, when pressures are mounted and when things weren't quite going right, there was a real disconnect there between what they wanted to do and then what they were doing, in terms of what the ability for them to enact what they wanted to and to farm in a way that was culturally relevant and traditionally relevant to them, in a way that they felt their ancestors would be proud of. So that was a real common theme around this identity, and that in itself created a sense of disconnection. More than that were the cultural influences. So cultural influences and norms within this community more broadly were really, really interesting to me. And there's been some studies that support these findings, but they did come through in the study. A real self-reliance and resilience that shaped their responses to openness around their loneliness. and distress, especially among the male participants, that lone working and isolation were often normalised as part of farming life. The cultural expectations often discouraged help seeking, and that could often lead to crisis. And even when the participants hadn't experienced that themselves, they talked about the community and how they all knew someone who had experienced that, and it had got to crisis point. And suicide was also a theme that came through when we were talking around loneliness and isolation. So whilst we know it's separate and it's not always the same thing, it was something that the participants really linked loneliness to, was this sense of suicide among men in the community. Loneliness was also often viewed as a personal responsibility, and that cultural norm almost reinforce this message of we just get on with it, we just cope. The next theme again was quite interesting around fragmented family farms, and this really links to financial elements of farming at the moment and the changes that that's having on the farm household. So in the words of many of the participants, the farmer's wife's got to go to work now. And this in itself, the role of the women changing and the women not being as available to be on the farm anymore, for many of the male participants was resulting in them saying, well, you know, I'm on my own now and I can't afford to have anyone with me. I can't afford any relief on the farm. So it was making them more busy, which in turn was resulting in isolation. This was also supported by two of the female participants as well, one of whom was in that position where they wanted to go to work. For them, that was a positive protective factor, but they really recognised that that was leaving their husband on the farm without that social support. And also a sense that not many people are visiting farms anymore, that the farms used to be the hub, they used to be visited by sales professionals and the community, and now that they were very much left on their own. Place came through really strongly, and this links to the earlier presentation around that, the importance of place and around that community, and a real sense of community decline, that communities were closing down, shops were closing in rural areas, that the pubs were closing down, that there wasn't anywhere to gather, to commune and to socially interact anymore. And when you're doing a busy farming job, that makes your reduces your informal interactions, that you're not randomly bumping into anyone anymore that you used to, and a real sense of loss in that, which I'll come on to. Also here, really importantly, when talked about health services, there was a real feeling that they were either inaccessible in rural areas or that they were culturally unaccepted. So a real sense of, yeah, but we don't want the formal health services. We could just sort this if we could, I just want to be able to meet with my mates and have a chat down at the local pub rather than a formal intervention. When asked about digital, there was a real mixed bag of emotions and feelings around that. Many came through to say that rural broadband was still an issue, particularly among the very rural farms. And for others, it was more linked to digital confidence, actually. For a few of the older participants, they felt that it wasn't something that they were educated in and wanted to engage with. That brings me on to the next sub-theme, which really centres around this loss and this existential dimension of loneliness, which was quite a novel finding for the study. This existential loneliness usually occurs when there's a life event, something significant, it's abrupt, it's sudden. It could be the onset of a health condition, it could be a bereavement, it could be financial concerns, it could have been a number of events for our participants. But it's the sudden onset of those that cause this existential crisis and a real feeling of they've just got to carry on. The farm doesn't stop, the work doesn't stop, there's no help coming, so they just have to carry on. And in that became a real sense of isolation that resulted in a further withdrawal and isolation from the community, and that in itself led to this existential form of loneliness and a real disconnect. So you can see here, Beth and it's a pseudonym, being surrounded by people doesn't always mean you're not feeling lonely. My world had suddenly stopped turning. My community just disappeared overnight. And that was linked to a sudden onset of a health condition. And it really impacted on that individual in terms of their experience of loneliness. Loss of purpose. These two themes link quite closely, but for a lot of the participants, there was also this sense of loss of purpose. More broadly, if we're thinking about a community level, for the farming community in particular, they're feeling really disconnected. Disconnected from their wider community, a loss of societal respect, a mounting pressures, and a real sense of being misunderstood by their wider community at the moment. On an individual level, that loss of purpose was also found in participants who had experienced chronic illness, bereavement, and those existential forms of loneliness. Loss of control. This is the other one. So at the community level, there was a real common theme that came through around the changes in agriculture currently and the pressures. And all of these pressures are mounting on this community on top of the busy lifestyle, financial pressures, political changes were leading to a real sense of uncertainty. And when we were talking about loneliness, it's important to note that the participants from the farming community particularly focused more on the stresses and the societal pressures at the moment, and that feeling of being disconnected. And that was creating this sense of what I would refer to as cultural loneliness, a real disconnect between the individual and the agricultural community themselves more broadly. It was a we feel misunderstood. We don't know what we're doing from this year to next. We need a plan. And these common themes that were coming through created this sense of cultural loneliness. And in turn, that uncertainty in the future was almost creating a anticipation and a fear of what's next. And then that was causing a withdrawal and an isolation in itself. Financial precarity and the current economic situation was also adding to that, and that was leading to reduced collaboration and also a decline in trust with policymakers. I know it's quite bleak, I'm really sorry. We're coming on to the positive bit now. Okay. So where did this lead me? The one thing that the participants really raved about was their weekly visit to the farmers' markets, to the livestock markets on a one day a week. That it's the only time that they were prioritised time in their schedule to go to an event. And these livestock markets became such a common theme and something that the individuals really spoke about. I pitched up there a lot and I spent a lot of time there. So it resulted in a case study, because when I was looking at reading the data and analysing it in terms of looking for interventions and what would work for this community, it was really clear that formal interventions were not their preference, and that this might be a space that we can uncover some interesting findings. So I looked at 2 livestock markets and did 2 in-depth case studies. One was a livestock market in a very remote rural area, and one was more closer to the English border, and a little less remote but still rural. I used the framework for meaningful interaction when looking at this to conduct observations, field notes, interviews to form a case study. So what we found, livestock markets really are the community hub for this population, and it really does provide that social opportunity, social connection that is routine and regular, and that's really important, something that's consistent in their week. It also provided culturally acceptable opportunities for social connection. Often that would lead to disclosure of need. So if there was a need, you would often see the farmers, just putting the will to rights with each other over a coffee, and that would lead to disclosure. So that would lead to disclosure and identification of need. At one of the livestock markets, there were embedded health initiatives, and this was really fundamental and really interesting to me, that at community level we can embed these initiatives in a way that is culturally acceptable and familiar to the farmers, delivered by people who understand that community, and that was really central to those initiatives being successful. There was also a lot of work with the businesses that pitched up and the stalls that were there, they were also doing a really, really good job at linking in with this community and reporting those needs back to other people where they felt that there may be a risk in terms of mental health. And in a time where the communities are declining in rural areas, the marts were felt even more important to them. And there was a real fear that what if they close, where will we go then? And finally, there's so much I can talk about with this study. It's really hard to sum it up in one slide. But essentially, I come from a public health background, and viewing this through that lens, we need to move upstream. We need to move beyond loneliness and looking at loneliness as an accepted condition, and we need to actually see this as something that largely could be preventable for the many, to free up services for the few that need them. And I think there is a real move with the social health agenda and really looking at those social determinants of health and really reinvesting back into those communities at a rural level. Also, accepting the cultural norms, and I think accepting that formal health services aren't really what everyone wants, and particularly for the agricultural community, it's not the formal approach that they desire. So if we can accept that, we can look at that and look at how can services adapt and be delivered at a culturally appropriate, in a culturally appropriate way, we might get a bit further, such as the example of embedding initiatives within spaces that are already adopted, and really equipping those providers that are already working with these communities, the rural and agricultural charities that do a lot of the work at that level, that are trusted and that those communities will engage with. And then strengthening informal support and promoting rural wellbeing. We know that there's a lot in the social health agenda at the moment. The World Health Organization are doing a lot of work globally, and I think in Wales there's a real desire to really move this forward. But how that looks in a rural area is up to us. So I think we just need to take these findings and hopefully look at what the next steps for me in my write-up are, what next. And I wish I had more to give you today, but I'll leave it there. Thank you.
And thank you, Stephanie, for that insight into what clearly is a complex area. And certainly I learned a few things there, so thank you for sharing that. Can I check within the room here in Belfast or online colleagues have any questions? We've got one in the front of the room here, Michelle. Just in front of you then.
Thank you very much. Are you farmers' daughters?
No, I'm a farmer's granddaughter. Sorry, farmer's granddaughter, but not a farmer's daughter. No.
So I think you give an excellent presentation. And you've covered so many points there, which were noticed by so many. Other parts you would pick up and thinking about the loneliness. Only the other day we had a lady who lost a daughter. And I called back and asked the mother, I said, how was she? She said, I'm very lonely. And I hadn't heard that before, you know, because we can go back and think to the agricultural community. As far back actually as the foot and outside, where they were isolated, they were kept from the markets, and then of course it wasn't that long before COVID. I know this myself, I've been having all the life, that the markets were getting empty, people were taking back into the slaughterhouses, etc. But they came back, going back in strength, because so much can carry on. You go into the market coffee in the morning, and you may have had a rotten day. The dog is dead, the cow is thrown the calf, and the sheep are broken out, and perhaps the wife is dead to go to work. But you do Saturday, I was talking, I was like, well, life isn't so bad after all, you know. But it means so much to be able to cover all of everything. And then we have started to see now in different markets, health farmers, which are there checking out everything from blood pressure to urine and whatever it may be, which is a marvelous move, I know, because I've been trying to keep checking some of those, and the issues they found for several people are quite, well, frightening in some ways. So, congratulations to you, I think it's fantastic. The other was, that's when the other was health services. I can honestly say I'm from this area. I'm a county councillor, I cover a large area. But sadly, we have surgery there, which is very, very important. You cannot, how you will only explain it to somebody earlier on, before the 8 o'clock, how you told you about 15-9. I'm sorry, I don't believe it, what they do. They won't respond to emails, there's a patient participation board, they take no notice whatsoever, you may as well talk to the board. I've even been in touch with them and said, okay, come and give a presentation to the community, they won't. That sort of thing, and this goes on, and I know that people in the area, especially in the further reaches of the community, they know the problems, and they don't bother to go to the doctor. And there are several in my area who have passed away because of lack of seeing the doctor. And they don't want to pressurize them. But I heard the National Health Service, this has to be addressed because it is a major issue in this area, I can assure you. It is worrying to a serious point, even now that it hasn't come back since COVID. Even collect prescriptions. Now we've got to go to a hole in the wall outside. You can't wait whether it be inclement or whatever it may be. We are going backwards. This is not the way to go. And it is down to management of the practice. So I must give them to you with national health to look into this. It cannot be left. I was with the community health service for a long time. Marvelous body, and it's took a charge. Sadly, no teeth. This is the problem. I was teaching health. I got in touch with them. They responded and said, right, the case is closed. How could it close the case when it hasn't been solved? The problems are surmountable in this area. And I beg of you, address this and see what is the matter. We need answers because we are losing people in my community. And I'm a community man. I've slept in the room here and they was my here. And I know most people in my patch. So Stephanie, you've done fantastic. Carry on with you. Give it on.
Thank you for that contribution. In fairness, Stephanie, that probably wasn't a question to you. That was more of an affirmation of the work that you've done, and just for the benefit of colleagues online. And I guess there was a rhetorical challenge there, wasn't there, for us in the National Health Service, certainly in terms of how we address some of those capacity and supply gaps within our local communities. We heard a lot about that yesterday and some of the initiatives that are being progressed at the minute to grow and develop and sustain a rural workforce. But I think the challenge that you've laid down there, Edwin, is a fair one. Yeah, it's a conundrum that's facing us at the minute. There's no easy answer, I think, for me to explore in discussion this afternoon. But the question is certainly a very pertinent one and something I know.
Sometimes something else can be addressed if somebody goes into a surgery, talks.
Indeed, yeah.
It's quite often the case, and you may be sitting next to somebody within a surgery, and you say, "Are you all right?" "Yeah, I'm okay." So, why are you here? But it's again, you've taught me.
Yeah,
that goes a long way.
That power of community, so it's absolutely great to do. So I think that's a fair challenge. Yeah, as I said, we did hear yesterday a number of initiatives that each of the health boards, not only Pavis but in Alvar and Betsy as well, are looking at to try and tackle that problem. It's a journey we need to travel together. So I accept that challenge. Can I just check if there are any other questions? Is one online? Yeah. Sure.
But I don't know what I notice is in my age group specifically, people in the early 20s sort of feel an obligation or pressure to carry on in the parents' footsteps, so to go to the farm or even a small family business that they feel an obligation to have to do that. whether you're to the university or any other path, it's just Boston Children program. So I'm wondering if that's something you might come across where they have sort of a lack of autonomy over what they're able to do in that sort of background, and whether that might contribute towards feeling sort of loneliness and whatnot.
So just for the benefit of colleagues online, so there's a question there around the extent to which the real or perceived family pressure to carry on within the farming community for those of the younger generation is in one sense a source of that subsequent sense of loneliness that develops in later age.
Yeah, I think that's really important. Succession was a major theme that came through around these pressures. I could talk to you a lot about this in more depth, but particularly, even though some of the participants for study 3 were that 40+, there was a real recognition amongst those participants of, I don't want this to go down to my children. I'm not encouraging them to come into farming because it's so hard. So that was a common theme that came through in terms of their concerns. And quite often you had maybe 3 generations that were really struggling with the management of that succession, and that absolutely led to an emotional level of loneliness for a number of participants. I did speak to a lot of the younger ones more informally rather than formal participants, and that came through strongly from them. But that many of them just didn't have time. They didn't have time to contribute a lengthy interview, which was a shame. But there is more work to do in that space. It could be a whole study in itself.
Thanks, Stephanie. And your presentation has clearly struck a chord, not only with the questions we've had in the room, but I know that on those online, there's the number of posts around support groups and the sector bodies that are offering support in this area. So clearly, this is you're pushing in the right direction here in terms of the work we do. So
Brilliant, thank you.
Okay, please show your appreciation again, Esther. Okay, now we move on to our second round of breakout presentations. So if I can ask colleagues who are intending to attend presentations over in the international building to move relatively quickly, because I'd be really grateful if colleagues would then regather here in the main pavilion at 2 p.m. for the next plenary session. So if you need to access the international building, please go now. Same advice to colleagues online. Just click the relevant links to the ground or first floor room in the international building for the talk of your choice. And here in the pavilion, really pleased to welcome Susie Scott, Lena Rowlands and Rhian David from the Hospital at Home Aberystwyth Volunteers. Just the two of you, right? Okay, just Susie and Alina. Okay, so Susie and Alina, please come up to the stage here. So you're going to talk about supporting bereavement in rural communities and the particular role of the grief companion. Yes? So please show your appreciation to Alina and Susie, and hopefully we'll have a really engaging conversation.
Working? That's right. And put them forward. Forward. That one. Lovely. This one here. Stand up.
Okay. So good afternoon, everyone. First of all, I want to thank Conference for giving us the opportunity to present our paper today. By way of some quick introductions, yes, I'm Susie Scott, and I am Gynhadledd Living Well and Bereavement Services Manager. And I'm joined by my colleague, Lena Rowlands, who's our bereavement counsellor. You might first not know or have heard of us. I hope that's not the case, but HAV stands for Hospice at Home Aberystwyth and District Volunteers, and we were established in 2015 under the vision and guidance of Dr. Alan Axford, who I know in the past has been a contributor here at the conference. We provide support to adults over the 18 years of age with life-limiting conditions, usually in the last 12 months of their life. We offer a number of services, all of which are free, and today I'm going to talk to you about our bereavement support service. I'm going to tell you how we arrived at the service that we run. You're going to hear a little bit more about it in detail from my colleague Gynhadledd, and you're also going to hear from one of our clients and her grief companions, and then we'll take some questions and answers afterwards. So, bereavement support in rural communities. Is this working? It was 2 minutes ago. I've obviously done something to it. There we are. Thank you. Press it a bit more. Press it a bit firmer. Right. Oh no, it's gone back now. There we go. So when we started our service in 2021, we were seeing a lot of older clients, people usually over the age of 65. And they were coming to us, and I think Marie Curie had done some research to say that older clients dealing with loss are the most physically affected by loss, and that they have a range of physical symptoms, which can include fatigue, it can include confusion, panic attacks, respiratory problems, aches and pains, and a lower immunity. And if you then couple this with the emotional impact of loss, and also maybe the loss of a life partner, therefore the loneliness, then it can be quite a frightening situation for older people to be in. What we found in terms of our community need was that older people are the cohort that experience the most loss because of the life stage they're at. But they also, and we've heard this today from Stephanie, they deal with multiple losses which aren't all death related, and we call that bereavement overload. And those losses can be related to the physical decline in ageing, maybe a loss of mobility, a change in roles, purpose and relationships. And in fact, when I was listening to Stephanie and she was talking about those losses, I kind of interpreted it another way, having based on my experience with clients, is that clients are dealing with an awful lot of changes and adjustments in their lives and find it very hard to deal with. So sometimes change, which we could perceive as positive, actually can be very difficult for clients to deal with. But this group, although they are exposed to bereavement and loss the most, are the least likely to ask for support. And when we spoke to our clients and asked them after they'd had support from us and they'd benefited from it, why didn't you come forward before? They said overwhelmingly that they felt a sense of guilt, that actually as an older person, they felt that this was just expected. They wanted to get on with their lives as their parents did. I think also they felt a sense of they didn't want to share private feelings. And if we look at communities, rural communities, and sometimes the loss of traditions, there is a sense, there isn't the same collective grief outlets that there used to be. So it's kept very much within the home. Sensitive touch. There we go. So the most common form of loss for the older person is obviously the loss of a lifetime partner. People that have been maybe in marriages 40 to 60 years. And it can bring with it practical issues, both for the surviving male partner and the surviving female. For women, there is a worry around finances and bills, and an independent age report discovered that actually a woman's finances are adversely impacted on the death of a male partner. For men, on the other hand, they experience more loneliness and isolation. That's because often it's the woman who is more of the instigator in terms of social relationships outside the home. But what happens is for both surviving partners, they can suffer, if they don't get the support, a prolonged grief, and the outcome of that is depression. So this was our response to the clients that we were seeing. We were fortunate to get a grant from Welsh Government under the National Bereavement Fund, which we set up in 2021, and we launched a new bereavement support service for the area called Grief Companions. And I'm now going to let Gynhadledd talk to you about that. This part of the presentation, Gynhadledd will be doing her part in Welsh, but there are English on the slides.
So thank you, Susie. So I'm now going to spend the next few slides outlining the role of the grief companion volunteer. Now, the slides will be in English, but I am going to be speaking in Welsh. So if anybody wants to have time to put their translation sets on, please do so. Sorry. All ready? Fel dwedodd Susie, mae gael ar effeithio pawb mewn gwahanol ffyrdd. Weithio mae eisiau cymorth proffesiynol, fel consela. Ond beth sydd eisiau gyda pobl eraill yw cymorth i addasu i bywyd ar ôl colled, yn enwedig os bod dim teulu yn byw yn agos. Ac yn fy ngwaith I fel conselydd galar, wy'n clywed na lot. Mae teuluoedd nawr yn byw lot ar wahân o'i gilydd, a oedd y cymorth bydd rhywun yn gael, dwi ddim na nawr yn y gymuned. Mae gwirfoddolwyr cymdeithion yn galar yn ymateb I bwlch yn y gwasanaethau presennol. Dyn nhw ddim yn gwnstelwyr, nac yn gyfeillion gwirfoddol, ond maen nhw'n cerdded gydag unigolion trwy siwrne o addasu ac ail adeiladu bywyd ar ôl colled. Mae asesiad yn cael ei gwblhau I weld beth ydy anghenion yr unigolyn ac yma fe gyd yn wahanol, ond mae'n rili bwysig. So wi sy'n tueddol I wneud yna, a wy'n hala ti awr I 2 awr gyda'r person yna I ddod I nabod nhw a beth yw anghenion personol nhw o'r gwasanaeth. Mae cymorth yn hyblyg I fyny ac 6 mis. A'r rheswm am yna, ni ddim eisiau yr unigolyn I fod yn ddibenadwy ar y cymorth. A gobeithio trwy cymorth maen nhw'n cael o'r gwirfoddolwyr, maen nhw'n datblygu'r hyder a'r sylfaen eto I ail adeiladu eu bywyd nhw. So dyma'r fath o gefnogaeth gall cymdeithas mewn galar ei gynnig. List cyseflon I wrando, helpu unigolion I gymryd y camau cyntaf I ail adeiladu, jyst pethau bach, lle mynd am goffi, mynd am dro. Byddwn ni'n falle'n cymeryd yn ganiatawol, ond amser chi wedi colli rhywun, mae hyder yn rhai bobl mae wedi diflannu y llwyr. Maen nhw'n cael ein anodd I wneud pethau dyddiol bach. Heddiw mae'r gwirfoddolwyr yn amgrymiadau am ymuno mewn gweithgareddau cymunedol neu gwirfoddoli, ac ail adeiladu hyder trwy cefnogi a bod yn rhan o weithgareddau cymdeithasol. Be sy'n tueddol I ddigwydd yw maen nhw yn colli hyder yn rhwydd. Mae hyder yn bregus iawn. A os gwed bod y rai wedi bod I wneud yr un peth am flynyddau, fel I fynd mynd I cynio lleol, bob naw dy merched, wedyn mae'r persona ddim yna. Mae rhai byd oedd yn rili anodd I fynd nôl yn ei rhywbeth fel yna. So beth mae'r gwirfoddolwyr yn gallu neud yw mynd gyda nhw, cwbl o weithiau, bod nhw'n dod yn iws I wneud yna eto, a dyblygu'r hyder na nhw. So helpu unigolyn symud I gyfnod o adfer, ac helpu unigolyn I gofio am ei anwyliad mewn ffordd cadarnhaol ac iach. Y llunio llefydd coffa, gwneud y temau I gofio, llyfrau llofion, neu sut I baratoi am achlysuron penodol fel penblwydd neu priodas penblwydd. Dyn nhw'n gwybod beth I wneud. Delio ac eitemau fel dillad, a helpu didoli eiddo personol. Fi'n meddwl am un cleiant, eto ddim teulu yn byw'n agos. Oedd wedi gadael dillad a sgidiau gŵr yn y cwpwrdd am fusoedd. A dim yr hyder I agor y drws, a jyst I ddechrau wneud yna. So beth oedd y gwirfoddolwyr yn gallu wneud? Oce, fe ni hwn yn ara bach, a fe nad I gwblhau y tasg yna. A hwnna'n symud y galar ymlaen wedyn i'r person yna. A hefyd helpu gyda tasgiau ymarferol ac cyfeirio ar gyfer cyngor gyfreithiol ac ariannol. So beth bynnag yw cefndir a profiad y gwirfoddolwr, mae pawb yn cael 9 awr o fforian cyn nhw'n dechrau y cymwrs i'r person. So mae'r hyfforddiant yn cynnwys dealltwriaeth y golled, galar a ffactorau sy'n effeithio proses galar, gwybod am sut mae gwahanol ffactorau yn effeithio ar alar, dealltwriaeth y modelau a theoriau galar a modelau profedigaeth, ymwybyddiaeth o effaith galar ar bobl gan gynnwys arwyddion a symptomau, deall sut i'r gyfathrebu'n yn ffeithiol ac yn dysturiol. Dyw cymdeithas ddim yn dysgu ni'n dda iawn sut i ddelio a siarad y cyffreddebu gyda pobl o fewn galar. So mae'r gwirfoddolwyr yn cael y profiad sut i'n gwneud yna yn ffordd sensitif iawn. Dablygu hyder o siarad am bynciau anodd a sensitif. O'n i'n siarad gyda un o'r gwirfoddolwyr fi ddos hyn, a siarad y cleiant, rai peth really sensitif a personol gyda nhw. Nhw ddim yn gallu siarad gyda unrhyw un arall, a na wedi gwneud cymaint o wahaniaeth i'r person yna i symud mlaen ar ei siwrne o lari. Pwysigrwydd ffiniau, cadarnhaol ac iach wrth cefnogi eraill, a bod yn ymwybodol o effaith personol galar a sut i ofalu amdano'ch eich hun. Ac hefyd dealltwriaeth yr hyn olygydd gan adferiad galar, pwysigrwydd pwrpas a gwdnwch yn y cyfnod addasu a thyfu ar ôl colled, a trosolwg i wahanol fodelau adferiad galar. A hefyd beth mae'r rôl cymdeithas galar yn edrych fel yn ymarferol. Ac hefyd, mae'r cymorth i bobl sydd yn cerdded trwy Allen Cyfan Challenge. So mae'r gwirfoddolwyr i gyd yn cael y siawns i gwrdd gyda fi a cael gorygwyddiaeth mewn grŵp neu yn unigol. A hefyd mae'r hyfforddiant yn cario ymlaen ynglyn â sut gael sgwrsio am farwolaeth a farw a sut i gwrando'n ddwfn. And these are just a couple of quotes. Dyma 2 dyfyniad yma. Un o cleiant Lili. Oedd Lili wedi cael llawr colled. A oedd hi'n stryglan i symud mlaen. So dyma quote o Lili. At the beginning, I thought everything was my fault. I had no confidence in myself. But through my companion, I'm beginning to understand things better. Now I take every day as it comes and feel bright about the future. Thank you. A gath i cymorth tuan am 6 mis. Ar y gwahaniaeth ddaddu'r person yn anhygoel. A wedyn ni, gyfyniad y Graham, un o gwirfoddolwyr ni. Giving one's time clearly is one of the most precious things we can do. This can be as simple as going for a walk or having a coffee. It's helping clients to integrate back into the world. I'm now also getting training in anticipatory grief, helping families prepare for difficult times ahead. And being a bereavement companion has shown me that grief is a journey, and being there for someone before and after death is part of our wraparound service. The big hug, if you like, that I've offers.
So, thank you, Leonard. So you've heard from Leonard and myself, but really the people you need to hear from are the ones that get the benefit of the service and actually also deliver the service. So we're going to hear now from a lady called Betty. She's given us her consent. She has become, I'd say, our poster girl for Grief Companions. Betty self-referred to us about a year ago. She's in her 80s and she lost a close friend. And we matched her with one of our companions, Kat. And this is their story in the short film we're going to show. We're just changing the settings. There we go. Really clear. Sorry, the volume is we're not going to do subtitles for Betty because she is very, very capable of speaking for herself and does so quite beautifully, but we'll have to maybe leave it if that's the case. But what you would have heard there is Betty talking about the loss, how it's impacted on her life. She was matched with a cat. And cats are I think she really captures and defines the service by saying we, the companions, are a bridge between where the client is and where they want to get to. And she decided that talking to Betty loves crafts, and she wanted to get out and maybe join a group, but didn't have the confidence, because one of the things with grief is that people lose confidence to go on to go out and be on her own. So she took Betty for 3 or 4 visits to this art group very close to where Betty lives. And Betty loved it. She's still going to it. But like, as probably Alina's explained, our companions are only with our clients for a limited amount of time. We're not seeking to make the client dependent on the companion, but to actually help them adjust to life after loss. And I think this is what Betty, through CAT's support, achieved. As I said, she's still going to the craft class today, and you know, is managing very well. So if we go to the next slide, sorry, can you have the next? So the benefits of our service, we've been going, as I said, for nearly 3 years. We've supported in that time around 200 clients. 80% of that cohort have said they've seen an improvement in their emotional well-being. That means that they have felt more confident and they feel better able to manage their grief. 75% of them also said they felt more supported, less lonely, and had started to make new connections and in some cases friendships. And we provided up to 15 new volunteering opportunities. Like any new service, there are lessons to be learned. These are some of the takeaways that Alina and I would like to share with you today. First of all, what we have seen with the older clients is that grief isn't just an emotional experience. It comes with practical worries and problems, and it can have an adverse effect on an older person's physical health. Bereavement support, we need to think here very carefully about the model of support, because sometimes one-to-one is not actually what's needed, and we see this more as a social approach to bereavement support, to helping people get out, adjust to a new life, re-engage with their communities. Older clients, as we said, do experience more loss, but doesn't mean to say they shouldn't come forward for support to get the help. And for the older generation, what we have learned, and today, you know, I know Elaine's been doing quite a lot of well speaking, it's really important we are able to support them in a language they feel comfortable with. So 20% of our team are first language Welsh speakers. All our material is bilingual, and we're now developing a library of Welsh bereavement books. And the other thing I think that makes this service distinctive is that we focus on recovery. You can't fix grief, that's just not possible, but it is possible to adapt to a life after loss. And I think that's what we're able to do. And by offering some intervention, we can sometimes prevent escalation of crisis later, and that's what we achieve to do. So I just want to leave you a quote, because when we talk about bereavement, and we've spoken a lot of bereavement on the older person, we are all going to experience loss in our lives. And I came across this quote and it resonated quite a lot with me, my own losses, as well as the clients that I've supported. The point we want to get over is not every person needs bereavement support. We're not trying to turn bereavement into a problem, medicalise it. We are just trying to be there to give people the support, the appropriate support, to reduce some of the later problems that could happen, such as depression, prolonged grief, And also when you have prolonged grief, you need more intense support. So we're trying to sort of stop that from happening and get in there a little bit earlier, and to let older people know that yes, there is support available to them. I think that's just our contact details. Diolch yn fawr. If you've got any questions, please. I'm sorry about the film. It's on YouTube if anybody wants to see it. There you go. Thank you.
Just check whether there are any questions from colleagues in the room or anyone online. Oh, I think we've got a question from the middle. Just step back onto the stage for a second.
I was just wondering if it's similar to the big manager.
We Ceredig investor.
So I'll just repeat the question for the colleagues online. So obviously the focus we work is in Ceredigion. Question around a broader geographical scope and scale for the work that is so successful in the Ceredigion area.
It's true, we are just Ceredigion. But I think there's someone here from Age Cymru. Hello. Susie, sorry, because I know that Age Cymru, you've established a service for the over 70s, haven't you? You've got a project officer, Samantha Owen, and I believe she is providing support. I'm giving you a plug, don't forget this. She is providing, we'll ask her some favour back in return. She is providing support across Carmarthenshire, Pembrokeshire and Ceredigion. And Powys now, right, she's got, you know, another colleague. So, you know, what I think that someone said to me when I heard about your service, how do you feel about that, Sue? And I said, I'm very happy. You know, imitation is the sincerest form of flattery, so thank you. And it's great because we do need these services for older people and supporting them with bereavement and loss. So the more we can have and the more areas we can cover, the better it is. And I think, you know, maybe Age Cymru would like to say a little bit about theirs and how it works, but I think it's not dissimilar to ours in terms of the support. Would you like to say anything?
Yes, I can.
Wait for the, yeah,
you do.
Unless you want to come up the front, Simon.
Good afternoon, I'm CEO of Recordiad. We do have, in partnership with our sister organisation here in Paris, a bereavement support service. It is Welsh Government funded and it is specifically for those aged 70 and over. However, being Recordiad within the age work, we don't turn anyone away if they have a need that is addressed elsewhere. And we're delighted, and I'm sure you'll agree, we could do yet more resource to support people going through grief. So it's a relatively new service for us. You, in terms of it being funded, we provided support for that funding for many years. Yes, that's a 3-year service. This is year 1 for the Welsh Government funding, and we're certainly working with our partners in the Executive Park to have more funding in the future. Thank you.
Thank you. And that is going to be the question for all of us, because a lot of us are funded by the National Bereavement Fund. When that funding runs out, and I'm sure it's been a pattern here today, what happens next? You know, because these are, you know, much valued services. And I think one of the things, the focus on recovery is really important because we are helping older people. You know, I mentioned about loss and dealing with change. We're helping them deal with that as well. So it's kind of an all-encompassing service in many respects. And I've got to say a huge thank you to our team of volunteers. We have 15 on the team at the moment. They give up their time freely. You've had that quote from Graham. And we just couldn't deliver the service without them, basically. So it's a huge thank you.
Good. Thank you both, and thank you, Simon, for your contribution to the work that Age Cymru are also doing in this space. So that's really helpful to them. Okay, thank you. So okay, so we're now going to move on to the next plenary session, session 4. Really looking forward to this session. So we've got 4 TED-style poster presentations lined up for you. These were selected as part of the submissions that we received for the conference this year, and we thought these in particular would be of particular interest and benefit for you as a delegated audience to delve into and hear a bit more about. So I'm now going to invite Karina, Maisie, just checking you're in the room, and we've got Rodri somewhere, hopefully he's here. I can't see him unless he's gone out to one of the breakout rooms. And we're also going to be joined by Bethan, who Bethan, grateful for standing in a relative short notice to deliver the presentation. So you guys can join me on the stage, and then I'll introduce you properly and give you a bit of training in terms of the work that you're doing. So if you can give the guys a round of applause as they approach the stage.
Yeah, we'll try to do it. We know you go first.
Okay, I think Rodri is with us somewhere. He may well be attending the breakout sessions, but I think in the interest of time, we'll make a start and then we'll work our way through. So first, I'm going to introduce to you Karina Sidhu. Karina's been doing some really interesting work looking at a traffic light system to support unpaid carers in rural communities. And Karina's going to deliver a presentation for about 10 minutes. And then she'll be followed by Maisie, who will talk about some really interesting work that she's been looking at, providing from a holistic perspective, allowing patients the right to die in the language of their choice. I think when we get to Maisie's presentation, Maisie, I think you're going to deliver it in Welsh. Yeah, so again, colleagues who've got access to translation facilities, just give you advance warning of that when we get to that presentation. And then once Maisie is presented, then I'll bring in Bethan, who will talk about her work and study at Liverpool University looking at grief prescribing. Yeah, and then Rodri hasn't got here, guys. We'll bring Rodri and then back in as the full presentation. So Karina, if you'd like to take the mic and begin from your presentation.
Just put it on there. You can hold it on your paper. Okay. Thank you very much. So prynawn da, good afternoon. My name's Karina Sidhu. As it says, I'm a fourth-year medical student at the University of Liverpool, and I'm really grateful to be invited here today, not only to introduce my work, but also to kind of watch a lot of really interesting talks, and I've learned a lot already. But yeah, so my work is a traffic light system that's aiming to support unpaid carers in rural communities. So before I go on to explain more about the traffic light system itself, I'd like to first highlight why I believe the tool is so necessary. So in 2021, around 10.5% of unpaid carers of the Welsh community were unpaid carers. Now that's more than 300,000 people providing regular support to family or friends with long-term health conditions. And I think this really essential contribution is demonstrated by the fact that the Welsh economy saves roughly £10.6 billion every year because of the work of unpaid carers. And then despite this really important and vital work, it's estimated that 57% of unpaid carers feel overwhelmed by their role. And I think that we'd all agree that that's a clear sign that better recognition and support is really needed, and that there's maybe room for a tool to help with that. So I've kind of, through my work, I've learned a lot about the specific challenges faced by people in rural communities, where existing pressures are often exacerbated by multiple factors. You know, now that includes things like limited public transport, poor broadband or digital connection, and also sometimes feelings of isolation. Of course, you know, it's important to point out that rural life also offers many advantages. You know, the support of a close-knit community and access to green open spaces. These are huge benefits of living in rural areas. But really, as I learned more about the challenges faced by unpaid carers, I was motivated to develop this traffic light system, which is designed to help healthcare professionals quickly and accurately identify carers who are at risk
and then to consider implementing some relevant interventions that would then helpfully help the unpaid carers' well-being and general health. So kind of a bit about how I went about designing the tool. So first off, I wanted the tool to be as comprehensive and as accurate as possible. So I analysed some of the existing carer assessment tools that are out there, and that includes the Carer Strain Index and also the Carers Alert Thermometer. Now, these tools have been instrumental in recognising carers that need support, but they were developed for very general use and may not fully capture the additional challenges faced by carers in rural communities. So after reviewing these tools, alongside the NICE guidance on supporting carers and also a variety of studies exploring the experiences of rural carers, I went about developing this tool, and I felt that my knowledge basis was at a satisfactory level. So I made sure to include a variety of more general and then also some more rural specific factors, and then to the best of my ability I grouped them according to level of severity. So I'll now explain a little bit about the tool. Obviously, I'm not going to go through it in depth. I have physical copies if anyone's interested, and at the end I'll be showing some QR codes which have a digital copy and they're bilingual in both Welsh and English. So the tool is designed to be as flexible as possible, something that can be used during GP consultations or more in the community, and hopefully as easy to integrate into everyday practice as possible. So each unpaid carer is assessed across several areas. Now that includes their physical and mental health, whether or not they have a level of social and emotional support, their access to public transport and local resources, and also whether or not they're comfortable accessing telehealth and digital services, and whether or not they face any financial hardship. So the first level here that we can see is low risk, carers who are managing well, seen in green. So these are carers generally who have good health. They feel that they're well supported by their community or families and friends, and that they're coping well with their caring responsibilities. And then amber, which is medium risk, really suggests that a carer is starting to possibly struggle. And this can be for multiple reasons. But for example, maybe they're starting to miss some of their personal appointments. Maybe they're not prioritising their own health to the same extent. And they may also be having limited opportunities for respite. And therefore that can contribute to feeling overwhelmed and stressed as well. And then the highest risk category, seen in red, reflects a carer who's in crisis. So that really indicates that maybe the health or safety of the unpaid carer, or possibly the person they're caring for as well, is starting to be put at risk. So carers should be classified according to their highest risk feature. So if they have one high risk feature, they then be classified as high risk. But then recommendations from this level and also possibly lower risk levels could be implemented. So, for example, someone who's a high risk might benefit from engaging with some respite care services, but then they may also benefit from something from the low risk category. So maybe they benefit from engaging with preventative health services. So going to see their GP regularly, or knowing that they're eligible for the flu vaccine, for example. And I think that becomes really relevant in rural areas where several factors can really quickly escalate a carer's risk level. So if someone loses a bus route, for example, that might mean that a carer can no longer access really vital appointments, and that can shift the situation from being amber to red almost overnight. And I think that example highlights why it's so essential that this tool included criteria that address the specific challenges faced in rural communities, and also why it's so essential that unpaid carers are assessed quite regularly, because their risk levels can fluctuate very quickly over time. So, the tool is still in its very early stages of development, and it's yet to be validated in clinical settings. And I've learned a lot just from attending some of the talks today. But for me personally, the next steps would be to engage with unpaid carers and healthcare professionals as well, to ensure that the traffic lights criteria and the recommendations as well are relevant and practical. I'd then like to collaborate with some care organisations and possibly some GPs in rural areas to trial the tool in real world settings. And then I'd go about collecting feedback to see kind of how it's being implemented generally and if that's been a success. And then ultimately, the goal is for the resource to be distributed on a wider scale, both digitally and in paper formats, just to make it as accessible as possible. So in summary, the Tropic Light system isn't designed to replace any of the existing care assessment tools, but rather to enhance them by adding that rural perspective. And, in future, I'd love to tailor the recommendations to specific local areas so that healthcare professionals are able to signpost patient carers to local infrastructure and possibly local support groups as well. I believe that would then make the tool even have an increased impact. But above all, I really hope that this presentation has shown everyone and really displayed how vital it is that we support unpaid carers. And I think we can all recognise that they're the often forgotten foundation of our health and social care system. So thank you very much for listening. Diolch am wrando.
Right in front of me. Thank you, Karina. Thank you very much for that. Okay, so now I'm going to call upon Maisie Edwards. So Maisie has been doing some really interesting work exploring the right of individuals to die in their language of choice, particularly in Welsh, where fertility focus. And as I said, Maisie is going to deliver this presentation through the media provider, and therefore for colleagues online or in the room who need to access the translation facilities, please do so. Yeah. Maisie.
Dim ots. Prynhawn da, diolch am y cyfle heddi I gyflwyno. Fy enw I Maisie, rwy'n myfyriwr yn pobl Mhrifysgol Aberystwyth. Ac yn archwilio I ddefnydd y Gymraeg o fewn gofal iechyd, ond heddi yn ffocysu ar gofal lliniarol, palliative care yn benodol. Yn cadw gyda'r arddull fel TED Talk, licen I ddechrau gyda stori bach cloi. Rhannodd un o'r nyrsys a gymerol rhan mewn cyfweliad am glaf yn ei 80au. Cafodd y claf ei referio I ofal lliniarol ac yn byw gyda cancer a dementia. Penderfynodd y tîm nad oedd gan y claf yma capacity I wneud penderfyniad am le ddylai mynd yn dilyn yr ysbyty. Cynhaliwyd cyfarfod best interest a phenderfynodd y gweithwyr iechyd y byddai mynd I gartref gofal. Ond pan edrychodd y nyrs ar ei nodiadau, fe sylwodd hi bod yr claf yma yn deillio o ardal sy'n cael ei ystyried I fod yn ardal Cymraeg, Gogledd Cwm Tawe, a soniodd ei bod hi'n cofio meddwl, walle bod y dyn yma yn siarad Cymraeg. Aeth hi felly I weld y claf a'i gyfarch yn syml gyda siwmai. Pwysleisiodd hi bod y claf ar unwaith wedi edrych lan, alert and connected yn geiriau hi. Fe sylwodd bod hi'n siarad Cymraeg. Trwy drafodaeth syml yn iaith y claf, fe ddaeth yn amlwg bod gan y dyn yma capacity. Roedd e'n deall beth oedd yn cael ei ofyn ohono, ac roedd e'n glir iawn nad oedd eisiau mynd I gartref gofal, mi oedd eisiau mynd adref. Mae hi'n nodi bod y newid syml hyn wedi newid llwybr gofal y claf, yn fwy unol gyda gofynion a beth oedd yn bwysig iddo fe. Mae hyn yn un enghraifft bod iaith rhywun nid yn unig yn cyfrwng cyfathrebu, ond yn rhan annatod o hunaniaeth, urddas ac am weld y person fel unigolyn gyda gwerthoedd. Dros y misoedd diwethaf, rwyf wedi bod yn casglu ymatebion ac yn cynnal cyfweliadau gyda gofalwyr iechyd, nyrsys, meddygon, physios ac yn y blaen, siaradwyr dwyieithog a dysgwyr Cymraeg. Allwch chi'n mynd i'r sleid nesaf? So just sleid syml hwn yw hwn I ddangos y dulliau fi wedi defnyddio. Mae'n rhannu eu profiadau, eu heriau ac yn aml y profiadau na sydd wedi dylanwadu arnyn nhw. Trwy ddadansoddiad thematig cychwynnol, I fi wedi ceisio tynnu mas rhai o'r prif themau sy'n rhedeg trwy'r transcripts ac yr ymatebion hyn am ddylanwad iaith a diwylliant ar ofal cleifion. Thema sy'n ailadrodd tro ar ôl tro ydy'r ffaith bod iaith yn gyfrwng I fynegu, sydd wrth gwrs yn holl bwysig trwy gydol gwasanaethau gofal, ond yn sicr yn wir pan mae rhywun yn teimlo ar ei mwyaf fregus, neu hyd yn oed yng nghyfnodau olaf bywyd, neu wrth gynllunio at y dyfodol. Soniodd un cyfrannwr, dwi'n mynd I ddarllen y ddyfyniad air am air. Ti'n marw un gwaith, so mae'n rhaid I ni wneud be da ni'n gallu I wneud yn siŵr bod o'n iawn. A mae cyfathrebu yn hollol bwysig yn hynna. Mae pobl eisiau rhannu atgofion, maen nhw eisiau rhannu gofidiau, maen nhw eisiau rhannu be maen nhw eisiau i'r dyfodol. Mae'r gair rhannu wedi ailadrodd fan hyn a thrwy gydol y data ansoddol. Mae nifer yn nodi pan mae rhywun yn agosau at diwedd ei hoes. Wrth gwrs mae meddyginiaeth a gofal yn hanfodol, ond mae gofal sy'n canolbwyntio ar yr unigolyn, defnydd yr iaith sydd mwyaf priodol a rhoi'r cyfle I fynd rhannu yn holl bwysig. Mae rhannu a mynegu yn y ffordd mwyaf naturiol i'r claf, gall hynny fod iaith y teulu, iaith ei blentyndod, iaith y gymuned, ac wrth gwrs, yng Nghymru, yn ardaloedd gwledig ac ardaloedd amaethyddol, dyna ydy'r Gymraeg. Nid siaradwyr Cymraeg iaith gyntaf yn unig sy'n ar sylwi ac yn teimlo hyn. Cefais cyfrannwyr ffisio yn deillio o Friste, ond bellach yn byw ac yn gweithio yng Nghymru ac yn dysgu'r Gymraeg. Mae hi'n ymdrechu I fewnbynnu ymedroddion a chyfarchion syml i'w iaith o ddydd I ddydd, megis siwr I chi a diolch. Soniodd hi am ymweliad I glaf sy'n byw yn ne Powys, ac wrth adael, fe ddwedodd hi, neis I weld chi, a dwedodd hi fe wnaeth y claf fel cymeryd ei llaw, edrych i'w llygaid, a sôn pa mor bwysig yw hi gallu clywed yr iaith. Dwedodd hi, it made my heart sing. Yn dilyn hyn, fe ddwedodd y physio, I realised maybe more people wanted to hear me speak Welsh. Soniodd y cyfrannwr am enghraifft arall ble gafodd neb yn ei tîm llawer engagement gan y claf. Pan gyrhaeddodd hi, roedd y menyw yn ôl y physio yn eithaf hostile a ddim eisiau help. Trodd y claf I siarad yn Cymraeg gyda'i merch. Dwedodd y cyfrannwr, chi'n siarad Cymraeg, dwi'n dysgu. Yn dilyn hyn am mwy o drafodaeth, dechreuodd y physio defnyddio ychydig o'i Cymraeg yn yr asesiad ac yn ei geiriau hi. She went from being really disengaged to being like an amazing rehab patient of ours. She teaches me a bit of Welsh and I teach her a bit of physio. Dengys y straeon hyn bod darpariaeth Gymraeg yn digwydd ar lawr gwlad, ac mewn nifer o achosion, mae'n rhywbeth hollol naturiol, mae'r cynnig ar gael o hyd ac yn rhannol o ofal a gwaith bob dydd. Ond mewn rhai achosion, dydy'r darpariaeth ddim ar gael, ac mae diffyg ymwybyddiaeth o'i bwysigrwydd. Yn yr anecdot gyntaf, roedd y claf yn llwyr ddibynnol ar rywun sylwi ar ei gyfeiriad ac yn meddwl o bosib y byddai'n siarad Cymraeg. Felly mae dyn ni fel postcode lottery a mae fe'n hollol lan I fel cyd-ddigwyddiad. Heb os, mae'n bwysig tynnu sylw at y thema o'r heriau cyffredin ac ymarferol sy'n bresennol trwy gydol y data. Fel mae pawb yn ymwybodol, mae'r llwyth gwaith yn uchel, turnover staff yn aml yn uchel iawn, diffyg amser ac adnoddau sydd I gyd yn dylanwadu ar allu wasanaethau i ddarparu gofal dwyieithog, ac weithiau mae pethau mwy clinigol yn cymryd blaenoriaeth. Ond mae'r iaith rydyn ni'n ei defnyddio yn gallu chwarae rhan hanfodol wrth greu ymdeimlad o gysylltiad, urddas a thywelwch meddwl. Yn y cyd-destun gofal lliniarol, mae'r pethau hyn yn amhrisiadwy. Ar hyn o bryd, dydy'r sector yma ddim yn rhan o grwpiau blaenoriaeth i dderbyn gofal trwy'r Gymraeg, ac mae'r data ansoddol cychwynnol yn awgrymu pan fyddwn ni'n cynnig gofal trwy iaith yr unigolyn. Mae'r effaith ar fywydau pobl a diwedd bywyd hyd yn oed yn wirioneddol hanfodol. Diolch am wrando.
I think that's really interesting to listen to, and really important lessons that they can share there from the work that you're progressing. Just contrary to my earlier running order, we did manage to find Rodri, so that's fine. So just before we bring Bethan in for her presentation, we'll run Rodri first, the way the slides are stored on the screen. So Rodri is with Powers Teaching Board, works within the respiratory service, and you've been doing some interesting work, I think, in how to improve access to services for patients in rural communities.
Yeah, trying to.
So Rodri, welcome to the stage, and over to you.
Thank you much, Lee. Hello there, so my name is Rodri Curtis. I am a respiratory and sleep physiologist. What that means in English is I do a range of diagnostic tests on patients who have respiratory and suspected respiratory and sleep disorders. So we went to the Royal Welsh this year and we did a spirometry screening event. I'll get onto that afterwards. So to start with, we see a broad range of patients in Powers Teaching Health Boards. Some of the groups of patients can be a little bit more difficult to engage with. And one of those groups of patients is those who work and live in agricultural environments. Therefore, the Royal Welsh Show is a perfect opportunity to try and reach these patients. So why would you want to increase encouragement with engaging with this population? So on the screen there is a list of lung conditions or diseases which are quite associated with agriculture, and risk factors which are also associated with agriculture. Agriculture plays a vital role and is essential in our modern day society. Unfortunately, the profession can carry a lot of health risks, particularly in the area of lung health. So some examples up there include COPD, asthma, occupational asthma, lung cancer, farmer's lung, pulmonary fibrosis. Although there are interventions to help reduce the harmfulness of these exposures, such as personal protective equipment, ventilated environments, these are not eliminated, unfortunately. And this is why early education, early detection of these diseases and early management strategies are vital in helping those in agricultural communities. With this approach, we can potentially reduce the risk of disease prevalence, reduce the risk of, reduce the speed of disease progression, and reduce unnecessary hospital admissions. In Powers Teaching Health Board, early prevention and early management of these diseases is something we're quite focused on. And with this approach, this can be applied to the rural setting as a whole. So we had some aims going into this event. To provide access to spirometry for all adult attendees of the Royal Welsh Show, of course, who wish to be screened. We've got to remember consent is important. To identify undiagnosed lung diseases among everyone that we saw, and to provide education and promote lung health to Royal Welsh Show attendees. So if you, whoops, my bad. So we operated a stand across the 4 days of the Royal Welsh Show. We manned this stand for 8 hours a day, and we had 2 spirometers on the stand. So I appreciate some of you are probably thinking, spirometry, or, oh, I covered that once in university. So spirometry is a breathing test which is effort dependent, and the test can show us a variety of measures of which we can use to indicate whether there's a presence of certain lung diseases. The 3 that we tend to focus on are asthma, COPD, and pulmonary fibrosis. So asthma is where we get inflamed airways and hypersensitive airways to various stimuli. There is a reversible component to asthma. COPD, progressive airflow obstruction with chronic respiratory symptoms, which is sadly not fully reversible. And pulmonary fibrosis, where you get scarring throughout your lungs, and it causes a restrictive component in the lung capacity and also with the gas transfer of the lungs. So in the 3 categories up there, we have the main symptoms from each of the NICE guidelines. So with your asthma, you've got breathlessness, wheeze, your tight chest, your diurnal variation of your symptoms, and any triggers that make the disease worse. COPD, breathlessness on exertion. So with your COPD patients, you often get them saying, oh, I used to be able to do this task just fine, but now I get worse and worse with breathlessness every time I do it. You've got frequent sputum production, and if you've got involvement of your heart, you get a bit of ankle swelling there as well. With pulmonary fibrosis, you get your persistent cough, your dry cough, again, persistent breathlessness. If you're listening to the chest, if you're qualified to do so, you get crackles in the chest, and you may also get finger clubbing, which is just up there on the board. If you go to the next one. So with spirometry, we can see different traces. So on your far left there, you've got your normal trace or a trace that's indicative of normal lung function. In the middle, you've got a trace which is typical of obstructive lung function. The other line above it is a reversible component to it. Unfortunately, that person's still got what we'd consider to be a fixed airway obstruction. And on your far right, you've got your restrictive trace. So after participants had completed their test, myself and the other clinician present would give them a result category: normal, obstructive, restrictive, or mixed. Mixed is roughly what it says on the tin. It's obstructive and restrictive mixed together. If the participant had abnormal results, they were advised to book an appointment with their GP to further investigate that result. So what did we find? We were lucky enough to be able to screen 154 participants at the Royal Welsh Show, 59 of which worked or lived in agricultural environments. 154 participants, of the 154 participants, 45, roughly 29% of them, had abnormal results, so either obstructive, restrictive, or mixed. Of the 59 agricultural population screened, 32% had an abnormal result. So overall, in the event, we were able to meet our aims. We provided access to spirometry to all the participants who wanted it, and we identified some undiagnosed lung diseases. And we were able to signpost those to the appropriate healthcare professionals. In our respiratory service in Powys, we've already received those some of those referrals for the ones that were in our area, and we were able to formally test those in a controlled environment. What's actually quite interesting is that the people who came in who had some obstructive results, such as asthma or COPD, those people were actually completely normal in our controlled setting, suggesting that there was some hypersensitivity in the environment that we were testing. And we were actually, if anybody knows the grounds quite well, we were testing in the sheep shed over there. So everybody's been there. Yeah, there's quite a few allergens going on in there. It was an interesting 4 days in there, actually. So we also met our aim of raising awareness of lung health by having valuable interactions with the public. Whether or not they wanted to be tested, some people just outright said no, but we won some people over, it's fair to say. Okay, our greatest limitation was that we were upstairs in the sheep shed and the lift wasn't working. So we very likely excluded inadvertently participants who were worse affected by lung diseases or those who were short of breath, because if you're very short of breath, you're not going upstairs, or you're not going to want to go upstairs in a leisurely event. Currently, we're planning to run the screening event next year in a more accessible part of the Royal Welsh Show. Hopefully as part of a wellness hub, so a load of Powys Teaching and Health Board services all in one area, so you can come around if you like. A side note, the Powys Teaching and Health Board does accept respiratory and sleep referrals from any healthcare professional if you're local to the service, ideally. And, you know, if you want to come and learn a bit more about respiratory and sleep diagnostics, we're happy to help where possible. So if you want to get in contact with us, you can come on into the clinic, observe the clinic.
Thank you, really practical example there, I guess, how we bring services closer to our population, and notable that your experience has also identified some practical opportunities for learning and improvement for next year. So in a way, it's a two-way process, so thank you for that. Okay, I should have mentioned earlier on that each of these presentations that have been discussed now, the posters are actually on the display stands around the room. So if you want to take pictures, if you want to grab some more information, please feel able to do that. Yeah. So our fourth presentation, I'd like to invite Bethan Ballon. She's a fourth-year medical student in Liverpool. Yeah. Bethan's doing some really interesting work on green prescribing. So please come to the stage and take the mic.
So hello everyone, thank you very much for that lovely introduction. Like I said, I'm Beth Bailey and I'm one of the fourth year medical students at the University of Liverpool. It's been great to be here today and hear all of the amazing talks that we've heard from everyone so far. And I'm honoured to be able to talk to you today a little bit about green prescribing in Wales, looking how it sustainably supports the planet, people and productivity. I do apologise in advance. This presentation was a little bit rushed putting together. I only had a couple of days, so please just bear with me. We may have a few technical issues, but we'll deal with that as it comes. So if you guys can, could you scan these QR codes and join my Mentimeter? I've just got a couple of questions, you know, fun facts, just to gain a basis of where we're all at, and then I'll explain them a little bit further. So I'll just give you a couple seconds to join into there. They are the same. Apologies about confusion. I just like to reach it. If you're struggling with the QR code, if you Google menti.com, M-E-N-T-I, and then you enter the code at the bottom, that should also help you to get there.
In the chat box, the menti.com and the code, and then I can put it out on screen. Probably put it on screen now.
Even if you guys can't manage to join, we will hopefully just answer the end and then we'll go through it all. So I'll just give you 30 more seconds and then we'll crack on. If you're having issues, don't stress. So the first question is just a little true and false, just to get you warmed up. So GP practices within 5 kilometres of a nature-based organisation have higher levels of green prescribing provision. I'll just give you about 10 seconds or so to answer. Just give you a couple. Okay,
2, is it? Yeah, you go back one.
Perfect. So it is in fact true. And I think this is quite a prominent statement considering the rurality of Wales generally, and that GP practices do tend to be within some location of a nature-based organisation. And then I'll touch a little bit more on that a bit later on. So on to the next question. So what percentage of the public answered that they are unaware of or don't know what green prescribing is, according to the 2023 Department of Health and Social Care data collection? Just the concept.
15 answers so far.
Yeah, we'll keep going through. Thank you. So the correct answer is actually 63%, which I don't blame you guys for saying 85%. When I first started looking at green prescribing, I was not aware that it existed. So you will actually be pleased to know people are a little bit more aware of it than we anticipate. We'll go on to the next one. So how much money did the government invest into the green prescribing programme in 2021? So this was a cross-government scheme implemented within the 25-year environmental plan to support people to spend time in both blue and green spaces. Yeah, so this is just in the UK generally. So the correct answer here is actually 5.77. So through this programme that was implemented, 8,300 people were supported with mental health needs. And I think we can all appreciate, I've heard so many facts and figures that have been mentioned so far during the conference, and 5.77 million is very much on the minority side of this, and it is something that we can look into increasing in the future. And then this is my last question you'll be used to know. So who can actually refer to green prescribing programmes? You can select them. Indeed. So well done, guys. So in fact, general practitioners, allied healthcare professionals and patients can all refer into the green prescribing programme. There are different programmes around Wales, and I'll kind of touch on those a little bit later on. Most of them you would go through a general practitioner who will then go through social prescribing and facilitate that transition, but there are some where patients can in fact self-refer. So we'll go back to this slide if that's okay. So I'm just going to start off by just giving a bit of a general introduction into green prescribing generally. So when we can get the slides back up, there is a definition on the screen, which is the NHS definition. So I've just kind of summarised it a little bit into my own words and kind of broken it down into what I'd like to talk to you about today. So green prescribing is a personalised intervention designed to support patients through encouraging participation in nature-based activities, with 3 main aims, which will come up very soon, of improving physical and mental health, but also alleviating demands on the NHS physically and financially, and then supporting the sustainability of local environments too. Within this, we can then look at sustainability and its definition, which is the ability to meet the needs of the present without compromising the ability of future generations to meet their own. So I've kind of linked these 2 concepts together and explored them through 3 different domains of people, planet and productivity, which I'll now explore a little bit further. So we're going to start off by looking at people. So this is just one set of statistics, and I'm sure that there are plenty more out there. But the National Academy for Social Prescribing have looked at people's perceptions of this intervention, both before and after receiving it, and have measured the following outcomes. So they found life satisfaction increased from an average of 4.7 to 6.8 when ranked out of 10. Levels of anxiety reduced from 4.8 to 3.4 out of 10, and happiness has increased from 5.3 to 7.5 out of 10, which is actually above the average of 7.4, which I think is an amazing statistic and just shows how effective this intervention can be. I think it's also really important to touch on the idea that the reduced social isolation that also comes with people engaging in these activities. It really helps to form communities and social networks, and I think it's really important to acknowledge that. So moving on to my next P, which is the planet. So green prescribing doesn't just support people's health and well-being physically. It also has a major role in supporting the health of the environment and ultimately the planet as a result of that. There are many different forms through which people can engage in activities like this, but the two that I'd like to highlight today is conservation through participation, where we help to give back to the environment through participating in projects such as gardening and maintaining local community spaces. The other one I'd like to touch on is through low carbon lifestyles. So these activities really help to support people through getting out and getting active and taking more carbon-friendly interventions such as walking and using public transport. So these actions help to increase biodiversity and reduce pollution, creating a sustainable environment for our future. The last P is productivity. So for this talk, I've defined this as the domain that focuses on financial benefit to the NHS with regards to money saved through reduced demand for appointments and changes to the allocation of resources. I'd like to touch on two local programmes that have published some results that they've seen from this. So the Making Well programme, run by the Family Trust, which is based quite locally in the Brecon Beacons, have found that there was social value cost savings of approximately £6.60 for every £1 invested into their programme. Another example is the Wildlife Trust, which is located in South East Wales, who are also very highly involved in supporting these programmes, and they've saved NHS mental health services £666,880 so far, which actually equates to £471 per participant. So I'm sure we can all see here the significance of these statistics. And then just overall, through providing these nature-based activities, there is reduced requirements for appointments due to better physical and mental health, which helps to alleviate pressure and costs on the NHS. In addition to the programmes that I've already mentioned, I'd just like to mention a couple more. So we were so lucky to have Rosie from Small Woods talk to us a little bit this morning about the programmes that they're running, and I believe we're hearing from RSPB later on today, who also play a significant role in help providing these services. And I think it's important to touch on the fact that Wales is such a beautiful rural area, and we are generally spoiled for choice with regards to being located around green spaces. And I think it's really important that we make the most of them. Recommendations going forward. So I think it's important that we carry out further research on the interrelationship between green prescribing and the environment itself. Furthermore, I think we need increased awareness of the successful outcomes associated with green prescribing to help increase patient uptake and awareness. As I'm sure we can all agree, 63% is better than it could have been. However, there's still a significant amount of work that we can do to help improve that. And then finally, integration of green prescribing referral options into clinical software systems in general practice, I believe will help make the referral process easier and then increase uptake further. So in conclusion, I'm sure we can all agree that the benefits of green prescribing to the people, planet and productivity all contribute to improving well-being, protecting the environment and delivering lasting socio-economic value. And us as healthcare practitioners and people who are active in our communities can help facilitate this as best as we can. Thank you very much.
Wow. So I think when we hear of the guys who are just starting out on their careers, leading such high quality and really interesting pieces of work, such as you just described, I think we can all allow ourselves to be maybe just a little bit optimistic that the future of of sustaining and delivering health and care and well-being in our own communities is achievable. Yeah. So I know you've found them all individually, but again, I just really wanted to show our appreciation to them as a group. In the interest of time, if you do have any follow-up questions for the guys, can I suggest you seek them out over the coffee break and explore those inquiries a bit further, because I'm mindful we've got a few sessions still to run through before we close this afternoon. Okay, it's now time for another break. Yeah. So we've got a 15-minute break scheduled now for tea and coffee, following which we'll be running our final breakout presentation session of the day. That's the third one, yeah. So again, please make sure you access the right location for the talk that you're most interested in, both in person here in Bill and for colleagues online. And then, so that will start just about 3 o'clock. So make sure you're in the right location for that time. And then, if I can ask everyone to try and arrive back in this room very promptly for 3:30, where we have a special treat for you, because we'll be joined by the 10 of us from the midnight, so I think we're actually getting the gala now, so we'll just give them time to dry up and settle in. So we'll be really keen to start that session as close as possible to 3:30 to give us a really positive end, which was really great couple of days. Okay, so please access tea and coffee in the back of the room here, and then make your way to the breakout presentation. Before the break finishes, break. Thank you. Okay, I'm delighted now to invite to the stage Dr. David Llewellyn. He's the wellbeing lead for RHCW Conference, and David's going to share with us an example of sort of striding, I guess, in terms of how RHCW offer opportunities to support health and well-being in the rural community by offering nature prescriptions to colleagues in our rural environments. David, you're very welcome. And we've got about 20 to 25 minutes for your talk, and then we'll take some questions towards the end.
Hello, da. Mae'n bleser mawr I bod yma prynhawn yma. Mi ddiolchgar ar gyfer y cyfle I siarad I chi prynhawn yma ar gyfer presgripsiynau natur RHCW. So, thank you very much for the kind invitation to speak this afternoon and tell you about the work we've been doing with nature prescriptions here in Wales. And first and foremost, my main take-home message is going to be that if you are in rural Wales, and we've already started working in rural communities and rural counties, then the opportunity is very much there for you to work with us to develop a nature prescription for your area. So I lead on nature and wellbeing for the RHCW here in Wales, and the main focus of that, of course, is to connect people with nature. We know now that the evidence shows very strongly that people who can connect with nature, we heard this a little earlier with Beth, benefit in terms of their physical and mental well-being. We know we've got a lot of challenges across Wales, both with physical health and mental health. So, the main focus of what we do are to produce these nature prescriptions. We can produce them digitally, but we often produce them, and mostly produce them in a physical format. And that allows then the health or associated professional to give this booklet to the person whose health they're looking to support. And I'll show you how it works as we go through the presentation. So my focus has been, because we've been funded by the People's Postcode Lottery, we were told to focus on Cardiff, and that was my job. But we've gone further. We've now done Cardiff, which we launched in July, and at the same time we did Newport. We're just about to finish one in Flintshire and Wrexham, and we hope that we'll be starting with Vale of Glamorgan next week, but also now we are likely to start in North Powys as well. We've got interest from Denbighshire in a different way, which I'll tell you about as well, and also Ynys Môn and Ceredigion. So, as I say, the bottom line and take-home message from this is, if you are involved in trying to support the health and well-being of people in a rural community here in Wales, and you feel that this is an opportunity for you to do so, then please contact me and I'll make sure that we get together and explore the opportunity. So, what are RSPB prescriptions? They are quite simply a very easy way of the GP, another health professional, community connector, social prescriber, or even non-health professionals who have responsibility for people's health and well-being, to give them one of these, which provides within it a nice calendar of seasonal opportunities for people to connect to nature close to where they live, and that's really, really important. And they can do that on their own, or they can do it with others. And the key element to it is that that professional or that person just has a conversation, as I'll show you, to encourage that person to give it a go and to take advantage of it. And as I said, there is this booklet of seasonal ideas. So that's very simple. Have the conversation, provide the booklet, and hopefully that person takes the booklet with them, does the activities, as you'll see within it, and the way they go and they benefit in terms of their mental and physical health. So I'm just going to show you, hopefully, there may not be sound to this, so apologise. So if the sound doesn't come up, don't worry, it's just a musical background. But this is one of the on-screen films that we've given for people in Newport. So that's the film that we've been providing the GP surgeries and other places in Newport, where people can get, as I say, a free RSPB nature prescription. We can provide them for free to the people who are going to give them out, and we also, of course, expect that they will give them for free to the people whose health and well-being they need support. So, as I said, we heard from Beth a little earlier on about the sort of economic basis. I actually work with the Gwent Wildlife Trust quite closely in Newport on some of the work that they do. But here's some of the evidence, because I understand and I really get this. I used to work for a Nine and Bevan Health Board, that people are quite sceptical sometimes about what those real benefits are in terms of connecting to nature. And it is about nature connection, which I'll come on to in a moment. But when I came into the RSPB, and my background, I was a senior lecturer in Cardiff University Medical School for 20 years. I wanted to be sure that if I was going to be involved in this programme, that that evidence exists. And we did a meta-analysis of what's out there, and we now know, and it's pretty well proven, that it can reduce people's feelings of anxiety and stress, can improve mood. So, for example, we know that there was a paper published by King's College a few years ago which showed that just listening to birdsong for about 10 to 15 seconds actually can reduce levels of anxiety by about 15 to 20%, and that can last for about 5 to 6 hours. So very profound effects from just something simple in connecting to nature. We know that it can reduce blood pressure. We know that it can have good impact on people's cortisol levels, our stress hormone dropping, levels of serotonin going up. We know that immune function can improve. So natural killer cell function, for example, involved in immune surveillance, is improved by people connecting meaningfully with nature. And we know it can improve people's physical health. And I won't go through all of these because I've been better to some of these earlier on. But we know that, as I say, if people do connect to nature and as a result of that also connect to others, that can avoid people being struggling with isolation and loneliness, which is a big problem in a lot of our communities. And just finally, a very quick paper, which is really interesting, came out from Harvard University at the end of last year. Connecting to nature can reduce brain activity related to pain. And that can be really a way forward, perhaps, for people struggling with things like fibromyalgia, etc., as we go forward. So, what is the proof that these work? We know they started in Scotland back in 2018. They've been now into England, and as I showed you, for the first time we've got them in Wales. And 75% of people who had a nature prescription said that their health and well-being actually benefited through it. And there were some lovely comments that came back as well in terms of anecdotal evidence. And we know that 91% of the GPs in Edinburgh who took part in it said that they would continue with nature prescriptions. And in fact, the latest nature prescription in Scotland is in Aberdeen, but there's also one in Orkney as well. And some of you may have seen a couple of weeks ago on the BBC that combined with Mental Health Day, just 20 minutes each day of connected to nature meaningfully can really boost your health and well-being based on that evidence I showed you a little earlier. So, what do we actually mean by nature connection? Because that's really, really important. You'll all know, I'm sure, about the 5 ways to well-being, and that's very much underpinning what we do with nature prescriptions. But the University of Derby, through Professor Miles Richardson's group, has also produced what we call 5 pathways to nature connection. And this is what you get when you take that 5, 10, 15 minutes each day just to really take the time, moments, not minutes, to connect to nature. So it's about contact. It's about using your senses, listening, hearing, tasting if you wish, feeling the wind or rain on your face. That's really important. It's about taking notice of the beauty of the natural world, because that makes us feel much better about ourselves, and also creating an emotional bond with nature. All these things really benefit our mental, emotional well-being, as well as our physical well-being. And it's about finding meaning. So that might mean, as you'll see in a moment, we produce this as a calendar. So throughout the year, you can find stories in nature that actually mean something. And I don't know about you, this time of year, I tend to get a little bit depressed, I'm really honest with you. You know, as the days get shorter, the nights are longer and colder, but you can find nature all year, and you can actually find different things that can benefit your health and well-being. And it's about showing compassion. Compassion for nature. We want people to act for nature, but at the same time, we know that nature can act for them. So it's about self-care as well. So, this is one more short film which will tell you what we mean and hopefully demonstrate what that means, that pathway to nature connection, and then I'll explain to you exactly how our prescriptions work and what that offer is for you today. So apologies, because that's the first time that film's ever been shown. I only put it together last Friday, so it's a bit of a rough edit at the moment, but hopefully it really conveys to you what those pathways are. They're very, very simple, and they're at the heart of what we do with RSPB nature prescriptions. So, we had a fantastic presentation earlier from Beth about green social prescribing, and when I was with the Nine Bevan Health Board, we set up a program called Kush, Nature Wellbeing, and that is what you might term pretty traditional green social prescribing, where somebody is referred to an activity, maybe a walking group, maybe a gardening group, maybe a mindfulness in nature group, and it works, and it's brilliant. However, what we did find, and this is why I was really wanting to come into this job and start to develop the RSPB nature prescriptions, is for a lot of people there are barriers and challenges still to being referred to a green social prescribing route. So the biggest one was probably motivation. When we phone people up to say, would you like to join this group? Would you like to go to this activity? I'm not in a good place. I can't go there. I can't be part of a group at the moment. I don't feel well enough. Or for some people it is, I don't have the money to be able to get there. I don't have a mode of transport. It's not at a convenient time of day, 2 o'clock on a Friday. So there are barriers and challenges that what we know now through the RSPB nature prescriptions, we can get around, and they complement all the fantastic aspects of green social prescribing, because it's about what people can do on their own doorsteps, in their own time, and as and when they feel well enough or able enough to do it. So that's why I wanted to get involved in this. This is the new Flintshire one that we produced. It's about nature connection. It's not about a backdrop. It's not about running in nature. As I said, that's brilliant because you get all the health benefits of running, etc. But connected to nature, just take that 5-10 minutes every day. That means that if you're a health professional, you don't need to know what's available, because what you're telling people to do is to connect to nature on their own doorsteps. However, within the prescription, we also provide a guide whereby people can find a route to get to those other activities as well. And as I say, it encourages people to act and get involved with nature where they are. So, how can nature prescriptions benefit rural health? It was interesting this morning, I spoke at a public health conference, and two people from very rural areas of Wales turned around and said, everybody thinks that in rural communities they've got nature all around them and people access it, and they don't. They just have this backdrop, and very difficult sometimes to actually access real activities around nature. We live in a rural community, and we know that there's an aging demographic as well, and people are less mobile, etc. So this is why I'm keen that we now, having developed ones in the cities in Wales, a lot of them, that we really spread into rural communities. And so there's the opportunity for you, as I said, this afternoon. So we produce these in co-production. We don't just say, here's a nature prescription for an area. We work with health professionals, we work with environmental professionals, we work with people, for example, in housing associations who are now giving them out, because we want to develop something that looks very much like where they live and what opportunities are on their doorsteps. So this is what a nature prescription looks like. It looks like a booklet like this. This is the one for Cardiff, and inside it shows you what it says. This is how it can benefit you, and this is how it works. And then inside, it's set up as a calendar. 6 very simple prompts each month. And if you do those, we know that you'll get those health and well-being benefits. We create a little space for people to reflect on what they've done, and we also suggest to them a place they can go on public transport if necessary to get to access more nature if they wish. And then we do this for the whole year, as I say, and then at the bottom you can learn more about nature, which is in keeping with the 5 ways to well-being, and we create some very simple links through QR codes and bit.ly URLs, and how can you help nature. And then finally, and this is the last couple of slides, at the back we say, here's a map, here's active travel route, here's the bus and train timetables, here's some nature identification apps that you could use. Merlin, if you've never used it, it's absolutely brilliant. They're all free. We don't put ones in that you have to pay for. And we provide some opportunities for you to download activity sheets that will connect you to nature and some local wellbeing support. So, final slide, I think. This is an added opportunity for people to support the well-being and health of people that they work with. It is not a panacea. It is not either or. It's something additional that you can give that will support people in terms of their health and well-being, and it has a basis to it that is really, really strong. And we know it works from our evidence. In Cardiff, we've already given out 3,000 of these to partners. And in Newport, we passed the 500 mark yesterday, and I provide training for people to use them. Key messages, it makes a difference. It's free, no big commitments, proven foundations, adapts to people's lifestyles, particularly when they're struggling with their mental health maybe, or they don't have socio-economic circumstances to be able to take advantage of activities. It's about nature connection, which is important. There are no side effects, and it adapts to everyone and is suitable and supportive. So we are producing versions for people living with dementia, we're producing ECP versions, and in fact we're working with the Flying Star team in Derbyshire on this as well. So diolch yn fawr iawn am wrando, wi'n ddiolchgar iawn bod chi wedi cael y cyfle i gweld beth ni'n wneud. Thanks for listening, and I hope very much that if you contact me and if you want to take advantage of it, I'd be more than happy to get in touch with you. Diolch.
Questions. Diolch, David. Thank you very much. Can I check within the room whether colleagues have questions to David or colleagues online? Can we get, is there any way we can get the mic? Just for benefit of colleagues who are on teams. Yeah, if you go back up here, David, it's easier. Yeah.
So, at the moment, we're not working in Gynhadledd, sorry, but we could do. And I'm sure my wife will be very pleased because she's a Gynhadledd girl. So, happy to chat to you if you think there's an opportunity in Gynhadledd. As I said, Ceredigion is in that sort of West Wales now at the moment, and Swansea will hope coming on board. So yes, if you want to contact me, let's see what we can do. We'll be delighted to work with you.
Just a quick question for me, David. Notice the reference to the offer of CPD support for referrals and training. Yeah. Can you just talk a bit more about that in terms of how referrals may access that?
No problem. So once somebody's expressed an interest in using one of these, so for example, yesterday I went to the health inclusion team in Newport. Who want to use them with people who are refugees coming in, etc. What I do is I can't do it on Teams, I can't do it in person. I go across and I basically take them through what this looks like, the evidence is, what those key messages are, and then I provide them with the booklets. Because it's a very simple process, and hopefully that just gives them the confidence to be able to use the nature prescriptions and have that very, very brief conversation. That's all you need to encourage people to have a go. So that's how it works. No more than that. No magic attached to it other than me, unfortunately, for some people, going across and chatting to them.
Yeah, well, David, thanks very much. Okay, we're coming to the end of our afternoon, or the end of the conference. So we've got a really special treat to finish now. So mindful that some colleagues are still due to return from their respective breakout sessions. So that probably gives us a few minutes to allow the our special visitors, the Cynhadledd 10 of us choir, to set up. They're going to perform for us and bring our conference to close on a real line. Before they do so, we'll just explain a bit about 10 of us sing for us, sing with us rather initiative. So we'll just take a break for a couple of minutes while other colleagues return from the other breakout. We'll just allow our colleagues and panelists to set up and ready to perform for us.
Super.
time of year that I need unless I take that cable back and do that.
I've had
rubbish days
in work. I've gone along to quick cable change if you want to.
Okay, just once again, just to have to take a quick cable change, just to allow colleagues both in the room and online to hear the content.
I've had rubbish days in work. I've gone along to quiet. All that worry, all that stress, all that trouble, gone to the back of my mind.
There's no need to read music, there's no auditions, everybody can join, we're welcome, everybody's welcome here.
When lockdown came, I had to, because my family are in Manchester and they're not near, so I was so lucky to have Sue.
Just think, if it hadn't been for the choir, we'd have never met, and that friendship would never have started. But I never thought really I'd have such a good friendship as we have got, and that's because of the choir, really.
You don't really need to be a good singer. You blend in.
See you later. Singing, the leaders, the people, everyone. I love it. See you in the choir.
I like coming here, you know, we can sing, and we're actually supporting 10 of us.
So I've seen firsthand how music can affect people in community, and that's why I love doing what I do here in Barry with this choir, seeing music affect people in community.
Okay, so hopefully that video, and hopefully you're able to catch some of the sound quality there. This gives you a bit of insight into the initiative and the connections that the Sing With Us choir programme helps build between everyone's engaged with it. So without further ado, I'm now going to hand over to the Lles and colleagues, tenors choir, yeah, who are really going to entertain us and help bring our conference to a close. Just going to let John from the tenors choir just say a few words.
Thank you very much. What a great audience you are. It's brilliant. All the rain we've come through has been worth it. On behalf of the Gynhadledd and Aberystwyth Tenor Sing With Us choirs, thank you very much for having us. And it's our privilege and pleasure to sing for you at this Rural Health and Care Conference. And I was thinking rural health and care. Well, we all live in this area, so it's you that we have to thank for whatever it is that you've done for our health and care. I have to say, looking out, most of you look as if you're in the youth club, but that's it. That's because I'm an old codger. We are a Sing For Us choir, and it was good to see that some of you knew that ABBA song and were singing along, and we will be singing other stuff. But now I want to take you to Memphis, Tennessee, and you're in a stadium waiting for the most famous, well-known person in the world to appear. And as you sit there, the music starts, and no, not Elvis. The tenor choirs will sing for you, Burning Love.
story of love. Have you been back on the yesterday? I'm moving further away. What to believe? All I needed was a loving day. All I needed was a loving day. All I ever knew. Sometimes when I recall my name, and it's only a name, and I need you. It's to the words that you say, it's getting harder to stay. When I see you, all I needed was a love you gave. All I needed was a love you gave. All I ever knew. Oh, you. What if I tell them to speak somebody like you? If you are going, do your things that are thing to you. But you don't. I will understand.
people have been such a great audience. We've come to our last number. It's called Sing for Life, and it's very special. It is actually Tenebris's own song. When the choirs started, people that were going to the choirs, all people who had been affected by cancer in some way or the other, were asked to write down in just a few words what having cancer, being affected by cancer, living with cancer, what that kind of meant to them. And then they 10 of us collected up all the bits of paper and gave them to a poet and songwriter. And out of it came Sing for Life. It was written first in Welsh. We're going to sing it in both languages, though not at the same time.
Say the words you want to say. What would you choose? It's only out of Stay for everything we say till the end. No matter how hard life gets, for your love. To choose, it begins and ends with you. So what will you do? Stay bright, stay
Yes, thank you so much for carrying out with us this afternoon. That was a really inspiring way to end our conference. Thank you to our singers and our wonderful conductor as well. So thank you for leading the choir. And that brings us to the end of our conference for this year. I'm so grateful to our singers from Tenbus for bringing us to a close on that note. That was really positive. And I guess just fits some of the messages that I'm taking away from these past 2 days. I don't know about you, but I'm certainly leaving here really inspired with what can be achieved if communities, organisations, cross-sector, come together and really find a way of breaking through some of those historical boundaries that have stopped us delivering the kind of connectedness and quality of service that our rural communities deserve. I've heard so many examples over the last 2 days of where colleagues have come together and really put the person at the centre of their thinking. I think that was enshrined by what we just heard as well in terms of the performance we've had from the choir. I want to thank personally you as delegates for your attendance over the last 2 days. Just give yourselves a round of applause there because I really think it's been very good. I also want to thank all of our presenters who we've heard over the last 2 days, both the plenary presenters and our breakout presentations. Again, if you just show your appreciation to everyone who's participated today. And equally, I want you just to really show your appreciation for the Rural Health and Care Wales team who worked so hard in putting this event on. Hopefully you find it really interesting and relevant for you. I know they really welcome your feedback, so everything that you can share with us will really help make the conference programs for future years. So thank you for your support in that regard. So just a couple of closing remarks from me. This is my very first attendance at a Rural Health and Care Wales conference. As I said, I'm leaving here truly inspired as to what can be achieved if we put our collective minds to it. The theme of this year's conference was innovation and improvement in the way in which we deliver health, care and wellbeing services in a rural environment. For those of you who were present yesterday, I've got the words of Dr. Chris Jones, the Chair of Health Education and Improvement Wales, ringing in my ears, I guess. He laid that challenge down to us, that to really encourage us to move on from ambition into tangible and practical action. And certainly for me, I've heard over the last 2 days so many examples of really valuable, inspiring piece of work that colleagues and communities are putting their minds to, that are really allowing us to bring communities together, strengthen service provision and build connectedness between communities in our rural environment. We heard so many examples yesterday of professions who were just refusing, I guess, to allow those traditional boundaries and barriers to get in their way from providing the level of support that we so badly need within our rural communities. We also heard from the leaders of our health organisations yesterday afternoon. And I don't know about you, but I certainly came away with some really positive messages from that conversation. Each of them, I think, restated their commitment to work across those boundaries that I'm referring to. They listed a number of examples where there are services being provided in that way already, but they made a public statement, if you like, of their desire to work really in partnership to provide the services that our rural communities so richly deserve. I was also left with a sense of optimism, really, from some of the things that they said. And there are a number of initiatives that they referred to yesterday afternoon that I think give us real opportunity to start to develop the quality workforce that we so badly need to deliver care and services across the rural environment, be that the medical school in Bangor, be that the School of Nursing in Aberystwyth, be that joint work that I think Powys and Hull are involved on at the present time in a joint development programme for healthcare support workers. And I can see Ellen in the audience. I know we had a recorded presentation from Ellen yesterday where she's talking about the integrated GP fellowship. All of those examples, I think, give us a real opportunity to grow the workforce that we need to sustain delivery in this part of the world. Today, our focus then shifted to some of the social determinants, if you like, on health and well-being in our community environments. And we heard so much about community-led action. We certainly heard so much around social prescription and how we can really generate and promote the well-being of our communities, either through support for carers or really unique examples to support bereaved and or isolated communities. We also heard a lot about food policy. Yeah, really interesting talks this morning from Simon. We've also had breakout presentations that really show how we can bring communities together around food to build that connectedness and address that sense of isolation. So I'm certainly leaving here really inspired. We have a lot to do. Yeah, I think that was palpable and paramount from so many of the presentations that we've heard over the last 2 days. But there is also much for us to build on. The other thing I think that really struck me over the last 2 days, and Anna and I have been chatting about this, is the extent, and we were hoping this would be the case, and I think it's become apparent, is the extent to which an event like this gives colleagues who are involved the opportunity to build connections with each other. So we've heard so many stories of how delegates in the audience have linked with each other, shared their own personal experiences about the work you're currently involved in, and also identified opportunities for learning and shared reflection to take the work that you're progressing forward. So I really want to thank you for your positive and engaging contributions through the course of the last 2 days. It's been really helpful. And I know the presenters will have appreciated the feedback they've received and obviously the questions that you posed them, some of them quite challenging and quite rightly so. But that really, I guess, is a reflection of your commitment to the task ahead of us. One last plug, if you haven't used your QR code, we really do want your feedback. And equally, if you've got any last evaluation forms you can share with us for the poster presentations, please drop those in the box as you leave. Other than that, I'm very mindful that the weather over the last 2 days has not been kind to us. Yeah, so and some of you have got some long journey home, so we're running a bit over time. I want to wish you all a very safe journey home. Yeah, I hope you're leaving like me feeling inspired, and hopefully see you next year. Thanks everyone. Bye.